Selectmen meeting December 15th of 2022 in Southbury Town Hall, room 205. I'll call it to order at 7:03 p.m. Can we have the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Selectman Kuhn will not be with us tonight. First part of the agenda is a presentation. Housatonic Valley Health District Representative Dr. Paul Nee. As you know, we are considering leaving the health district. We have been told that we would be getting updates and that Dr. Nee would come here and tell us about the enhanced services, how much better we're doing. And we're at the 11th hour of making a decision, and frankly, I'd like to hear what is going on with the health department. Dr. Nee, are you here? Is that mic? Mic is on.
I guess you can turn off the Zoom. I got that. I asked you that a couple days ago.
I'm sorry?
I asked the Zoom link a couple days ago. I rushed over here, but I didn't get it in time.
Okay.
Yeah. When was that sent? Does somebody know?
I just heard about it 5 minutes before the meeting.
Oh, okay. All right.
And I think the email, I have not seen the email. I understand it was sent.
Well, I sent you an email a couple days ago, but asking for this. Let's first start off is we did have some communications over the summer. Am I correct in that? You and I, emails. And with the last email that I had on September 15th, you told me that you were going to the Board of Finance and you would be leaving the district and asking for my resignation at the last meeting. That was the last communication you and I had together. There were some before this in which you, we talked back and forth about some things going on, about some of the fees. We had discussed that. There was a little bit of a back and forth. There was some other things that were written in the email about me being a physician, and it was a very bizarre email, to be honest with you, but that's sort of where we were this summer. So I don't know why it's my fault it's last minute. You told me you were done with me in September, so here I am. What would you like to know?
Well, one thing, are we able to get the fees straightened out? We are charged.
As I told you in the email, and when you dismissed me at that point, it was not settled. So if you did not bring back that to the board. So my question is, Mr. Manville, again, you know the answer to this. I didn't come here to fight with you, but you have done nothing but obstruct me in trying to get things done. Did you bring up what Mr. Jim Britton went Washington when he reached out to you to try to solve this problem about your response to him?
First, we've had a number of meetings with all of them, and there is in the budget, there is a profit built in, according to Mr. Brighton.
We've gone over this, Mr. Manville. I have sent you the letter from the attorney on the buy-in and the Attorney General's ruling on that. We have also there has also been a detailed letter sent in regards to that. We cannot take money from our grants and put it towards the general funds. That is what you continue to talk about as profit, but it needs to go towards the grants. Okay? So that's that. What the board needs to decide now, and I'm a citizen, I'm a volunteer for this, Mr. Manville, okay? Volunteer. Am I correct in that? Because you appointed me,
yes.
The board appointed me. Am I correct?
Yes.
Okay. I've done everything. I've tried to balance this out, tried to work with you. You've been obstructionist about the whole thing. I'm willing to share those emails if anyone wants those, okay?
Information.
Yep, public information. What the board needs to decide, are they staying with the district or not? Everything is amenable. We can discuss moving forward, or does Southbury want to go on its own? You have made it clear that you want to go on your own. I guess the question is, what does the rest of the board want to do? And that's your decision tonight. Now, you have made it public and in your emails that I'm not a finance person. 100% agree. 100%. I'm a physician. I see the world differently than you do, okay? And what I bring for Southbury is my understanding as a physician in the world that we're living in and trying to help our citizens be healthy and well, okay? Freely admit, and you've pointed it out in the emails, that I am not a finance person, okay? But this looks pretty straightforward to me, and the answers were pretty straightforward also, okay?
Do we have any questions of Dr. Nee in the Health Department?
I do. When was the last time the health department had a meeting?
We meet on a monthly basis. I can pull up the list here. We met January, March, April. You were at that meeting. June, September. We were meeting, but we didn't have quorum at that point. October. We did not meet in November because we did not have quorum, but we did have some discussion at that point, and we met in December.
Okay, and where would I find the minutes?
The minutes, I believe, are, they should be posted on the website, but again, October's minutes would have been approved in December, so I don't know if they're up yet, right?
Oh, okay, so there's a significant lag time.
Yeah, there was no meeting in November.
Got it.
During these meetings, was it ever discussed the issues that I've brought up about the difference in the fees between those joining and the cost to the three towns?
We did not meet in August, and we did not meet in September. That email, I emailed you that we didn't have quorum at that time, and then that's when you dismissed me at that point, so I figured it was you did not want.
So there's no communication with the rest of the board members or with?
Oh, no, we have discussed, have some discussions about that, yeah, and there's
What
been,
did they
yeah,
feel?
there was no movement on that. There was a 5% that was brought back for environmental fees that you turned down. That would have certainly helped the public here. 5% back is better than nothing, but, you know, again, you have to remember the fees are all going to equalize in July of '23. And we've, again, explained what the reasoning was behind that.
What was the reasoning again? Refresh my memory.
The reasoning was there was no fees in Washington or New Milford at that time, so this was to get their citizens caught up.
And what was the real rationalization for not just saying this is the fees that we charge in Pomperaug Health District? If you want to join, that's what they are. Rationale for not assigning
I don't know.
that
You
fee.
could come to the meeting and ask. You know.
No, you're the rep.
Yeah. We did discuss it, and you know, and they said, this was, individual. But then again, you have to remember, I have no other rep with me. There's nobody else. You've not appointed anybody else since you browbeated poor Mr. Hunter out of the
Merger
district.
was done with another representative on the board. When this merger happened,
I wasn't involved in that decision. I've told you that before.
as our rep, you were not involved in the decision?
I was not, when that discussion took place, I was not present with that initial
About the fee
discussion. But
structure.
since then, yeah. Okay.
Okay.
And then the other question I had was, there was a report in the paper about $48,000 that Southbury's overpaid, or it paid extra. What is that? I'm questioning where that's coming from. I was quite shocked. I mean, I was shocked to hear that you said we weren't communicating. We've been communicating. I mean, but until you dismissed me, right? Was that a dismissal of me? Was it?
The communications with me and the board and what's going on has been minimal.
Mr. Manville, I was with my family on vacation, and you emailed me, and 48 hours later, you hit me with another email. What's my answer? And on vacation, I said, listen, I'm away. Here's the information. Here's go for it. How much more can I do? I'm on vacation communicating with you.
Well, there's not been much communication.
Okay,
even
okay.
with the merger.
Thanks.
So,
Does
are there
anyone
any
else
other
have any other
questions of
questions?
Dr. Neal?
There's no answer to the 48,000, because I would like an answer to that, where that came from, because that,
John, you have the answer? Could I hear the answer?
I think we have a case of a misunderstanding in the press about what was said. Last year at budget time, the Board of Finance felt that a $200,000 budget at $10 per capita was appropriate. We were faced with a budget from the district of $1278, I think it was.
no, it's
The health district.
1010.
1010 was Pomperog. The
No, it's 1010. Am I correct? Yes, it's $10.10. We deliberately, kept that. We're not paying $12.
it was changed. We were.
No, it's 1010. And I can show you that. So, okay.
Well, we were unaware that it was lowered from 1278.
It never was,
To-
it never was that.
Okay, well, we can look that.
Ms. Member, you were at that meeting, remember? You were there on December,
The
when we discussed
Board of
keeping-
Finance didn't know that, and we will get that squared away.
Okay.
But where did the $48,000 come from? We understood at the time of the budget that the per capita charge for Southbury, perhaps wrongly, was $248,000. The prior at 1010 for the health from Pomperog was $200,000 in rough figures. The difference is 48. What the Board of Finance did in the budget for the town, we budgeted the 200 because we felt the reasons we outlined for reducing the original budget we got, or the final budget we got from the Houstonic Valley. We thought that would be changed, and we decided that we would go through with a budget at 200, and if the Houstonic Valley budget was not changed, which it has not been, I understand, then the extra $48,000 would come to a town meeting with the Board of Finance recommendation to take it out of surplus. So that, it's an internal Southbury accounting thing, and I don't think the paper explained it that way. Okay.
But basically, the town paid the same amount per capita.
Yeah.
Yeah, okay.
Absolutely.
Okay.
Yes.
All right, thank you.
Yes.
Appreciate that.
Yeah.
Not too bad at math, huh?
Any other questions of Dr. Nee? Go ahead, John.
So, and what I'm hearing and what I've understood in my mindset is that for the first year, for a first period of time, that there was a difference in what Southbury might be charged compared to New Milford and Washington because of just the way they were previously set up and previously billed and budgeted
The
and,
per capita is the same.
right? But the fees and the user fees
And-
were,
and-
so what
and-
I was, and I think what I had said was, or what I meant to say,
Right.
the user fees were set up different for the first period of time because that's the way they were previously. And come, and I think I just heard you say it, June 2023, they will basically be equalized so
Correct.
that the fees for all the towns will be the same.
Correct.
So a lot of what Mr. Manville has, First Selectman has a problem with is this unequalized fee structure, which is going to be resolved in 6 months.
Correct.
Okay, I just want to, that's the way I understand it, that's the way you understand it.
Correct, the fees will be, yep.
So half of our problem, or what we perceive as a problem, maybe is going to go away in 6 months.
Well, the simple solution was to lower the other three members to their fee rate. And
But
it is,
what I'm
it is a
getting at
little-
is that-
it's a little bit ridiculous to think that the three original in the group would be expected to pay a higher fee than the people joining. If you want to join, that's fine. But the fee structure is what our fee structure is. And you can say, no, I don't want to join because of the fee structure. I've been trying to understand why that would be given to two new members who are benefiting from supposedly benefiting from joining the health district, why that would be given away? Because in fact, if their fee structures were the same, higher, there would be more money and less per capita.
But all I'm
We're
trying
offsetting
to
it.
make, all I'm trying to make clear or understand, and I just want to make sure I'm understanding it properly, is that it was set up that way just to kind of keep status quo moving into the first year, and everybody kind of, at least the board, bought into that and agreed, and we were billed $200,000 plus or minus numbers, which was covered in our budget. So we weren't overcharged, we weren't overbilled, we were billed what we had in our budget, which we were told was gonna be there.
And
Except
the
the
fees
added
fees
fee
for
structure-
Salisbury are the same, sorry.
Yeah,
But the added, us paying more on the fee structure is subsidizing the per capita for them.
so.
No question.
Totally agreed, and so the budget was decided, it was all based on an unequal fee structure, probably shouldn't have been that way, maybe.
And
we
refusal
could've-
to
but-
change it by their
But all
board.
I'm getting at, and I just want to make sure we're clear, is it come June 2023, that'll all be finished. And then we'll be working into the fee structure that everybody pays. And I just want to make sure that as we move on with the
They
discussion
could vote to
tonight,
change that now if they want.
but I'm not going to throw away the bathwater and the baby and everybody else just because it's going to be fixed in June. If we can fix it earlier, great.
A
But
simple accommodation would be to equalize the fee structures. They could vote on that at a special meeting, equalize it, and we've been asking that since the merger happened.
Mr. Manville, it's been one thing after another. You've changed the narrative multiple times here. It's this now. Before it was the buy-in, right?
I agree with the
Before that, right, which, you know, and then it was, so it's always changing. You want out. You want out. It's bottom line. Be honest.
John, do you have something?
No, I just, there are two different kinds of quote fees. Fee for, John, I'm not so sure I understand, you understand. There are two different kinds of quote fees. There is a per capita fee, which is the net result of the whole operation not being funded by the first kind of fees, which are fee for service. Okay? And it's strange to me, it's not my place to get into this.
Okay.
So, but I do think I understand what you're saying, is fees for services were different from town to town, but per capita is per capita.
Per capita is per capita.
I'm with
Correct.
us.
But the per capita, if.
Could have been different if the fees were different,
If
but they
the-
weren't.
And our representatives are okay with this.
I would say, if you're talking about us as representatives, we're not, but it's kind of water under the bridge, so we're moving forward. That's just my
Yeah.
opinion. I did just have one, because, and I'm just trying to get my head wrapped around just different things that we've heard and seen, and, so, because I think 2 weeks ago or whatever, we talked about that the board hadn't met, and they only but what you're saying is they met January, March, April, June, October, and December.
Correct.
So they have been meeting on a regular basis. Cool. And then, and there has been communication between you and Jeff. I mean, it might not
Yeah,
have
it
been.
stopped. It stopped,
Might
though,
have been
but
two
yeah.
ways. It might not have been cordial, but it was communication.
Yeah, not cordial.
And you weren't asked before now to come back and just kind of give us an update.
No, I was told I was going to be, you know, recalled, as I heard last week. Yeah.
Yeah, and I'll say that I was given some information as far as you're not meeting, you're not communicating, you're not doing, I was like, if he's not doing all that kind of stuff, there should be a recall process, but that might not be the case of what we've been told. I'm good.
Can you help us better understand the idea that what we see as being a profit line is actually grant money? Or perhaps Mrs. Morrissey, who's here, can help us with that?
Can she come up and speak? Sure, she can speak to it.
Good evening. through the chair. So one of the things that we have discussed as a board was that the budget was put together in November 2021 by Mr. Kevin Anderson, who worked in the for-profit commercial sector, not in municipal governments. And the budget that I inherited, and one of the feedback that I gave to the board was that, in my experience, I've never seen a budget where you include the grants on the same sheet with the general fund, because it gives the impression that you can use grant funds unrestricted, which is a problem because all grants come with very strict guidelines in the contract language as to how you can use them. And we've been having a lot of discussions both with the town chief elected officials, with the board, that there's this concept that there's an excess or a surplus of $262,000, which matched the epidemiology laboratory capacity grant for the same dollar amount. So that $262,000 was intended to pay for nursing staff, epidemiologists, and contact tracers, not to be applied to the budget to lower per capita or eligible to be paid back as some type of excess or overage inside of the budget. And so much so, our district attorney, the attorney for our board of directors, solicited from the state the Attorney General's opinions as to if that funding would be eligible to go back, in which we were sent several opinion letters, in addition to the buy-in fees and how all of those pieces would work. And that was distributed to each board member as well as each CEO back in May.
So Justin, to that, I'll ask Ms. Morrissey, during all this going on, obviously there's been issues between Southbury and the district, and this was out there. Did you make any effort to sit down and explain all that with me or the Board of Finance or our finance people?
So as per the board structure, the board representatives have those conversations with the CEOs as appropriate. And as per our last communication that you and I had was very hostile, and per advice from our board attorney, when you engaged your attorney, any communications that I would have to go through my attorney. So I had to go through the board attorney to communicate with you, because that's the level to which you brought it, since you brought the attorneys in.
But you've not made an effort to explain that?
It
What you
was
just
explained that
communicated.
there was a letter, it's 27 pages, and it has the explanation from the attorney, as well as several documents from the state's lead attorney for opinions going back for 30 years as to why it can't be done, and how it, one, jeopardizes the district from getting funding from the state, how it jeopardizes us from being able to collect grants in the future, and I thought that was pretty explanatory as to why we could not do that.
Ms. Morrissey, I have a few questions. Was it, and I realize there's a 27-page paper, was it clearly explained to the First Selectman's office that you could not communicate with him directly? Because my understanding is that you were not responsive. Was there a succinct explanation that, I'm sorry, I can no longer communicate with you directly?
So, yes, our attorneys and the town attorneys had communicated, and it was explained to the clients on both sides that the communications were going through the attorneys. At one point, there was conversation that the meetings were actually going to be had in the attorneys' offices. It had deteriorated to that point, and that's why it then no longer happened.
So what's different tonight? What brings you here tonight?
I'm here tonight because it's open for public comments. It's a public meeting. And I was
So
just
then-
invited up to speak.
Sure, so then I guess that leads me to the next question. If we've had this contentious problem for so many months, the better part of a year, I have to say I'm surprised to see you here tonight and not in the last 7 months that this has come up. So I'm curious why tonight, if we've had public comment every other week for 7 months, the door's been open, your name's been discussed many, many times in this room on recording, and I have to wonder why now, if you've been prohibited from speaking with the First Selectman's office, but now it's different tonight, to say this in no other blunt terms, where have you been this whole time?
So I'm happy to answer that. So first of all, I would like you to appreciate the difficult position that I've been in. We're still in a pandemic. I'm dealing with COVID-19. I'm dealing with monkeypox. I'm dealing with running a health department. In addition to that, I've had some very hostile communications come from Southbury, and I've had to sit by and listen to myself and my team be disparaged falsely. That is not an easy position to be in, and no one wants to feel like they have to be in a position where they want to say that someone is saying a misconception or somehow miscommunicating something. When the board representatives and the board attorney aren't able to get that message communicated through the appropriate channels, it doesn't feel like the appropriate place for me to insert myself into politics. I'm here for public health outcomes, not for political health, if you will.
So-
Tonight, I'm here because there's a vote as to whether or not you're leaving the district, and that's fine. Southbury will do what Southbury thinks is the appropriate thing for the residents, but there was an opportunity for public comments. And if Southbury is going to decide whether they're staying, they're leaving, whatever you guys would like to do, I would like to be on record as to say my piece in this and what happened, because a lot of communication did go back and forth. This information was provided. This information was provided as far back as May. So I would like that on record during the public comments. Thank you.
So I'm still struggling through this. So your job, and I completely appreciate this, I'm also a volunteer in many capacities, and I understand how difficult that it is, and you can get spread very thin. But the concern that we've had here, and where we have talked about this many times, is that we have felt that there was a breakdown in communication. And perhaps it would not have escalated to this point had we had more visibility from you and your organization. It kind of is a two-way street. I realize that the first selectman's office may generally be your point of contact, but you were here in this room with us a year ago. This door is open. I'm still kind of struggling with that, because maybe it didn't have to go so far, because we have had one executive session with our representatives. Aside from that, I really haven't seen much in the way of communication. I have a selectman's email. I haven't received anything. And here we are, we're in a position where we're down to the wire to make a vote, as you said, and I haven't seen you in the better part of a year. And when you were here, what was explained to us was a name change. And it was not 3 votes going to another town, the allocation of fees. Those things happened in this room, and that was the last time we saw you. So I'm struggling with that. Now it's public comment. It's always been public comment.
So, Selectman, I'd like to point out a couple of things. One, you've never invited me to a meeting. 2, I would also like to point out that when your board representatives feel that this is a hostile place for them and their voice isn't heard, and they're supposed to be your primary communicator, the way that the chain of command works is that the feedback from this group and from the town flows through your board representatives to me, and I get them the information that they need to bring back to you. And if they feel that they don't even know what the questions are, that they feel like they're being met with hostility, so they don't even know what it is that they need for me to answer, other than we need to defend the character and the integrity of our staff. And so I'm not quite sure how you want me to address that piece. And secondarily to that, and I hate to put Dr. Nee on the spot here, but we were told that all communication goes through the first selectman.
Yeah, correct.
That's what we were told. So that same piece is, I will just say that.
Yeah, and I asked during a session if I could communicate with you all, and you were all like, no, first selectman. That's what I was told. You guys were in that room.
And without getting into the content of executive session, we did have an executive session that I felt there was quite a bit of open dialogue. So I'm kind of surprised to hear that, because when we left, there was a couple succinct points that we had questions on that you had advised you'd get back to us on. And I actually felt like we had a pretty good flow of dialogue when we were all together, so I
Would agree, and then when getting back, it was, again, met with hostility, and it was to get back, when we discussed it, was to get back to the first selectman.
And did you?
Yes, I just said I did.
Okay. Would you, go ahead, John.
I was just, I don't know if you can. And I don't know if you can speak to this, but I mean, I'm getting a lot more information from newspapers, from other members of other commissions and committees, and, but we've been told that Woodbury or Oxford are not happy with the way that the system is working either, but I'm reading and hearing differently. Can you make comment? Is there any other concerns or comments or problems that other towns are having, or?
So I can let you know that New Milford and Washington are having no problems. First Selectman Temple from Oxford has actually gone on record at his Board of Selectmen meeting to say that they're happy with the services and their intention is to stay with the health district. We met with the town of Woodbury and it was a very positive meeting, and they felt that there was amicable relations on both sides and that all of the perceived issues that were happening were maybe the result of miscommunication, and it was warranted to have further discussions. We'll be back there next week, and I personally feel that it was positive. They were asking that, you know, if we had to leave our Southbury office, would it be considered that we would think about placing an office in Woodbury? So I'm going to consider that a good sign.
Right. And then just a quick question about, again, where we're getting information from, and like, we received some information from a resident, which I'm just kind of surprised that we weren't, I got my information this week from a resident versus, you know, other channels, but this document was sent to us, and did we get this to the Board of Selectmen, or was this just to your office?
What document is that?
That review from the attorney's office that detailed out all their questions and answers, and that we should be working through an attorney.
I think that came from the attorney.
Right. And it was
I
sent
don't
to-
know, John.
No, that, we sent that to you, Mr., me and the other representative sent that to you in May.
So I feel bad for these guys. I mean, I'm getting this from a town resident.
From a resident?
A resident, right? We all got an email with 7 attachments of all kinds of information. This letter that we budgeted 200,000, 200,000 was invoiced. You know, just a bunch of different details that I truly believe that we were not informed properly.
I don't know where that came from, I'd have to look.
This was the email that we got a couple days ago, and you just confirmed with the resident that she was speaking personally as a resident versus from her job position.
Can I just ask a clarifying question? The memo you're referring to, John, is that a May 18th, 2022 memo from Minchella Law?
Yeah.
And included with that, is there a memo from Ann Newman to the Board of Directors on May 18th as well?
There's, like was said, like 40 or 30 pages. There's exhibits, all kinds of details. But my number one detail is that there were a bunch of answers and communication.
Yes,
with-
those, so I
I'm sorry,
haven't
yeah.
commented yet on this other stuff, but I do need to respond to that.
Sure.
We did not get that from a resident. A resident forwarded it to us a couple days ago. Jeff Manville sent it to all 6 of us on June 28th, 2022 at 8:47 a.m. So we.
Okay, and that's what I was asking.
We got that information then. I just
Gotcha.
want to clarify that statement there.
And that's all I was asking is, did, you know, because we've seen a lot of documents come back and forth, and, you know, thank you.
But John, you just said that you felt that we weren't getting the information. We have had it, and for months. That, I mean, and I'm not trying to be disrespectful, but literally you just said, it feels like we're not getting all the information. I mean, it was shared
Well, we're
with
being
us.
told that there's no communication, we're not getting any answers, we're not getting any details, there's nothing coming to us. And so, quite honestly, the communication that I'm hearing while I sit at a meeting, I kind of take it for granted. I didn't get an email that specifically said, hey, I'm putting, you know, that said, oh, wow, we are getting some communication, seems to be a little aggressive, let's take a look at this and let's read it and let's get a little deeper into it. And by all means, I'll go back and revisit that, but I'm just saying that it seems to have been an aggressive conversation, and I think we just need to settle it down a little bit and communicate so that we can make sure that we make the right decision versus.
I think it's a frustrated conversation. Depends on how you want to put it. I am extremely frustrated. I'm frustrated that our representatives allowed different fees.
I'm past that.
Frustrating. I still think that there's a frustration about the lack of communications when this whole thing was done. When the very beginning, there was little communications and things that should have been brought to our attention, which was a memo to the Department, the Public Health Commissioner, that New Milford was to get one more vote than any other member of the district. That shows intent of what New Milford wanted to do with the district. We weren't told that the fee structure would be different, that they would be given that. That was left out. So at one point, I said, I think we need to put the brakes on this 2 days before. And our finance director was in the room, and you can ask Mr. Colton what was said by Mrs. Morrissey about something to the effect of, too bad, that's how it is, in 2 days it's done. To that effect.
I'm kind of struggling with this. So Woodbury is being given the opportunity to have us sit down and hammer through some conversations. Are we?
Yeah, go ahead. Yeah. wait,
Yes, of
so-
course.
The first selectman of Woodbury actually called and invited me to come to their meeting to answer any questions that their Board of Selectmen and their Board of Finance may have. They put together a list of questions that they would like us to address at that meeting that were pertaining to the types of services that we were providing, and really wanted to have an open dialogue to really clear the air, because they too saw some articles in the newspaper and some quotes, and they had questions about it, and they wanted to see what was fact versus what was, how sometimes in the media, as you've both already commented on, sometimes the story isn't always as black and white as it's portrayed. So we had that opportunity, and I thought it was a very productive meeting. If the town of Southbury would like to, have a meeting and invite us to come and really go through that, we would be receptive to that as well.
Just seems awfully late in the game. And,
Well, Woodbury's meeting was just the other day, so they called and asked if we would come this week, and I was very happy to do so, which isn't much different than now. That was on Tuesday? That was on Tuesday, so just 2 days, 48 hours difference.
and I'm still trying to wrap my head around this, and I respectfully understand that you felt that these correspondences were hostile. This is the job. This is the health district that was inherited, and let me speak this out. And I realize, Dr. Nee, as well, you've been very animated tonight. This has been going on for most of 2022. We've had discussions. We met in the summer. We expressed how extremely concerned and upset we were, and here we are months later, and almost nothing's happened. And then I kind of feel like we're in a rock and a hard place where we say we've barely heard anything in months, and we're down to the wire to make a vote that is a critical decision. And this last meeting, the last meeting that we had, we spoke to excess about the lack of communication with the district. So here we are, and it's December 15th, and we have until the end of the year to make a big decision. And I have to say, I realize how animated and upset that you may be, but it is mutual, because we've been here all year, and we have expressed numerous times that we don't feel like we have the information that we need. We don't understand why things happen the way they happened. There doesn't seem to be a fair distribution of not only representation, but the fees. Nothing's been getting done for the people of Southbury, which is one of 3 towns that started this health district. We were told in this room that there was a name change, and then it became, we're adding 2 towns. Now this district that was ours and we built has morphed into something that we feel that we are completely out of touch with. And for most of this entire year, we've been expressing frustration and communication. So I don't understand how, now all of a sudden, the other 2 towns who have also been upset are suddenly getting answers, and we're suddenly being welcomed to answers on December 15th.
So I'm happy to answer that in several parts. So first, this December 15th, this created urgency is from this town of Southbury. This is not from the health district. This is because you guys want to make a decision by December 31st to let the state know that you want to leave on June 30th. There is no one forcing you to do that. That is a decision that you've elected to make. I will also like to say that we've been talking for a year. Answers have been provided for a year. For a year, I've had meetings, which, again, like I said, we at one point discontinued, where I actually came out of those meetings and I had to tell my board of directors that I felt so threatened, and I felt that the level of hostility that was directed at me personally and the level of animosity and personal attacks that I was under made me feel worse than anything that I heard in my entire career and during COVID-19. And that's a really big statement coming from a public health director who had to go through the public ire of masking, that had to go through the public ire of vaccines. So when I say that I have gone out there on a limb to try to make this work and to foster communications to only feel like I was being a victim in a meeting, that is a very big statement.
Then,
Wait,
can I
I
ask,
gave you a chance to speak, please let me finish. In addition to that, we have made overtures. Our board has made overtures, and I will not presume to speak on behalf of the board and how your board reps feel. I'm telling you about my personal experience. So you have the opportunity to stay in the district and to see how it works out. If you feel that you want to take this opportunity to leave and go find greener pastures or start your own health department today, that's a decision that you can make based on your conscience and how you feel that that will serve the residents of Southbury. But I can tell you, without a doubt, that I am proud to serve on a team of public health professionals that serve this town 7 days a week, doing vaccines before school, after school, drive-throughs in the weekends, answering questions from the community, going to your nursing homes, responding to outbreaks, being there on some of the worst days of your residents' lives when they've lost loved ones, when they have people who are in the hospital, when they found out that they are now at home dealing with monkeypox, when they don't know about Ebola, and now they're being told that they're Ebola travelers, and they have questions and concerns about the community, when they want to put a septic system in, when they want to put a pool in, when they don't know what happens when they have arsenic in their water. My team of professionals have been there, regardless to how this board has treated them, regardless to how we've been portrayed in the media, regardless to the things that have been said to them. So, please make your decision as how you see best, but do not try to portray this, that we've created this urgency, that you have to make a decision today.
so
Thank you.
can you clarify the December deadline that we have to, can you clarify that for us?
The Connecticut state statutes say that by December 31st, if a town would like to exit a health district, they have to do so by December 31st to make it effective June 30th the following year. So if you don't make a decision between now and December 31st, you will be in the districts on July 1 next year.
So
That's what
it
that
sounds
law
like
says.
we are up to a deadline, and that is imposed by
Of
the
your
state.
choosing.
What's
Of
that?
your choosing, because this is not like every single year that you have to file a renewal or file that you're leaving. So this is a deadline that is self-imposed, that you've decided that you don't like your board reps, you don't like the health department, whatever reasons, you don't like the decisions that they've made. You've decided that on December 15th, you want to make the decision to get the paperwork in time for December 31st to make it happen for June 30th. That's not something that I'm imposing on you. That's nothing anyone's imposing on you. That's something that you as a board have decided that you want to do.
Well, it sounds like that's statute. That's statute.
Well,
I mean, we have
I
a
can
decision
tell
to
you
make.
that, I can tell you that the other health districts in the state, everyone's not meeting this week and next week to decide if they want to leave. That's if you would like to leave, that's a decision that you make. You could have done this in August, you could have done this in May, you could have done this on March 1st if you had elected to do so. You chose to do it today. So again, please do not try to portray this as I'm creating this urgency to have you make a deadline today.
Okay,
That's of your
I still
choosing.
have a couple of questions. So going back, and I realize what you're saying is that we have postponed it. I think we've been postponing it, hoping that there could be some resolution. But now there isn't. But this is statute. This is Connecticut state statute, and that, I mean, it just is what it is. We have to make a decision. But I do have a couple other questions. When we opened the pool this year, were we granted the permit timely, and why or why not?
You were granted the permit timely, and actually, I have the emails, and it was shared with the board. The issue was that the first selectman was arguing that because the businesses in New Milford and Washington did not have to pay fees, that the town of Southbury did not have to pay a fee, when in fact it was an error in the communication that went through in the invoice. It wasn't marked as municipal, so the $200 fee was attached to it. So there was no delay in opening it. It was a question of that we received some nasty communications because the businesses were granted a break, that the municipality felt that it was also entitled to break. And if you would like, I'd be happy to submit that communication to the Board of Selectmen. Also, I would like to add, with my last 2 minutes, I would also like to hear tonight, while you make the decision to leave, if you could also explain to myself and to all of the residents who are at home, where exactly the town of Southbury will be going for its public health services, or if you will be starting your own health department, and if so, how will you be meeting the 10 essential services of public health? So
Well,
that was the other piece that I'm interested in.
Respectfully, Ms. Morrissey, I don't think that that's a demand for you to put on us. We have to work through that, and I think, I think that's a little bit absurd to say that right now we're supposed to tell you what our plans are. We are in a rock and a hard place due to statute, and we have dragged this along as we can because we have felt a lack of communication along the way. And, I understand and I appreciate how you have felt along the way, but this board has been here. We have met in executive session. We have met with our representatives in executive session. I don't think there's any mystery here in the town of Southbury that we have been struggling with this health department and that this has been an overwhelming problem for us through the majority of the year. In fact, I would say this has probably been our most burdensome problem throughout the year, has been this health district. And, I fully appreciate that you're here. However, this could have been solved many months ago. And I think that you have been aware that this has been a problem. And I'm just struggling with this explanation
we have
that
tried,
we've been too
and
busy.
we've met hostility again and again. We've been threatened, you've threatened me with throwing me up against an ethics committee, Mr. Manville. As a physician, you would do that to me? That would be detrimental to my career. If you want to see those emails, I got them too, okay? That's the problem, the hostility we're meeting. He wants out. That's the bottom line. Ms. Sullivan, you can keep fighting or do whatever you want to do, but that's the bottom line.
No,
And you know what?
So, hold on.
I'm going to ask
So-
a genuine question. In the last comment, it was said that there was hostility from this board.
No.
And I'm trying to wrap my head around that because that was the comment that was literally just made, that there was hostility from this board. When the opportunities that I've had to speak with you, these were not hostile in the slightest. And so to come in here and say that this is hostility from this board, which is what was just said on camera, I'm really struggling with that because here it is December 15th, and now it's being put out to the public that somehow we have had a hostile relationship with you, and that is not the case. That's simply not the case.
I've not had a hostile relationship with you.
So there is an awful lot here that needs to be fixed, and if it's going to be fixed, then I would say that we have a very short clock to do that.
There's also been, let's face it, there's also times when two people are not getting along or disagree. And one of our concerns, and we have been talking about, was perhaps we need new representatives on the board. And that's a simple fix.
Yeah, so because we've been going through quite a bit, and I just wanted to just summarize the way I'm hearing things tonight. And by all means, as health professionals, thank you for your services. I mean, you're the one we call at night, you're the one we call on the weekends. I'm having problems, by all means, hats off to you guys. But I think we've heard a bunch tonight, like, I'll put my glasses on so I can read my notes. That the communication was okay, but it seems that if we have to get attorneys talking to attorneys, it is somewhat identified as hostile. A budget versus grant, and then we've heard the word profit thrown in there. But at the end of the day, it's basically the way the budget was done. There's the budget, and then there's grants and what the grants are used for. Coming from doing some nonprofit work where we get grants, and Petrina Foundation tells me with my Girl Scouts that I can do a certain thing with a certain money and I try to move some things around, but if it has to fit their needs, that's what it is. So those are two different piles of money. Totally understood that, but it kind of may not have been totally clear the way it was presented to us as profit. Thank you for the understanding. Fee structure, I understand, I think, that it will be changed by the beginning of next term, so June 2023. The only thing that I don't think I've heard an answer from, and I know we've heard the questions and comments and complaints, but if you could shed some light, because the only thing that's missing in my mind is, so why did New Melliford get one extra vote?
Because of the town size and based on the population of New Milford, right?
So it's basically as
So
simple
They
John,
have
as.
3
Up
votes.
to
as simple
10,000,
as-
you get 1 vote.
Based on state
Over
statute.
10,000, you get 2 votes. Over 20,000, you get 3 votes.
Right,
But there was a memo from New Milford and signed by New Milford and Washington that said that with this merger, that New Milford, no matter what, let's say Southbury goes over 20,000, we would get a third vote, third voting on the board. If we were, with that memo that they sent out that shows intent, if we went to 3, if we got over 20,000 people and went to 3 representatives, New Milford's intent was to have 4, always have 1 more than anybody else. That was the intent that New Milford wanted joining this. It didn't happen because it's not statutorily, they can't, but it shows the intent of the people joining this health department.
so to
Can
go
I
full.
just,
Jason, go ahead.
Yeah, so on that memo, we've all heard about this memo, we've all seen this memo, everyone's asked a lot of questions about this memo. When we met with you, I think you had indicated you had never seen this memo before. Since Ms. Morrissey is here tonight, perhaps we can get some clarity on the genesis of this memo? Like what, because, we've all seen it, there's been a lot of talk, but I've never actually heard a real explanation of it.
Right, and because I think I did ask way back, if it was just a memo of what they were shooting for, that it didn't happen, it was fine. If it's just statutory, I'd like to hear that we're just gonna follow the rules.
So that's correct. It was just a memo. It was an intent, and as it was explained by the state and attorneys for the district and attorneys for the 2 towns, once the town elected to vote and join the district, it evaporated, and they had to follow state statutes, which they have done.
But it
Did
did intent.
did the board of directors, I can't remember now, it's been a long time since I've seen this memo. I thought that there was some approval from the board of directors or something.
So the
which caused
board-
some of the, I think, tension, that we've been experiencing. So can you just explain that, the genesis of it, how it came about, the discussions?
So I can only speak to a limited amount for a variety of reasons. One, I was the acting director for Pomperaga at the time, and I was the director for New Milford. And I elected to recuse myself from the process as the district and the towns were deciding how that joining would look like. From the conversations that I was a part of, one of the concerns during the initial pieces was that New Milford was concerned that because of the number of other towns that they would not have adequate representation. As they went through and they were starting to learn more about the statutory process, they felt comfortable knowing that the number of votes would always be decided by state statute as opposed to an arbitrary ruling of the board of directors.
So they, essentially what I think I heard here was they realized that they would have control. That's, go
So
ahead.
it sounds like it was their wish list, and then they were overridden because they found out there was a law against it.
I couldn't speak to that. I'm sure that you could invite their attorney or the town mayor, and he would be able to speak to that for you.
But the health department was on board with that?
As I said, I recused myself from the process. It would be a conflict of interest, as I said to the board of directors, to the town attorney, to the CEOs for both towns. I could not be involved in that process because it was a conflict of health.
Sure.
And as I've indicated, I have no desire to be involved in political health.
No, but this is this is now after the fact. So as the director now, can you speak to like what the minutes would reflect what happened? I mean, I get that you've recused yourself from the process. The process is over and done. But what happened?
You would have to ask the Board of Directors. I was not part of that executive session. So if you went back to the minutes, you would see the discussion. I was not a part of that conversation.
Okay, so you have no knowledge of it?
You would have to go back and look at the minutes.
But you had no knowledge of the,
As I said, and I said, like, if you would like to speak to the attorneys, they would tell you that I was not a part of that process. For reasons, I don't want to ever be perceived of having a conflict of interest, so I was not part of that. Contrary to what the newspapers say, I was not the one promoting any towns joining the district, because again, as I said, I did not want to have a conflict of interest in that process.
But that's not really my question. My question isn't about being part of the process. My question is a factual what occurred, and I would think that as the director, you could just tell us what happened.
I was not the director of the health district at that time. My job was to ensure that the 10 essential services of public health were being met during the interim process until they decided what they were going to do next. So, that being said, that is not something that would have been the scope of my responsibilities. That being said, for the town of New Milford and the town of Washington, who I was their director of health, I was not involved in the process because it was a conflict of interest.
Yeah, it definitely, I sure see how it is, yes.
Jason?
One of the questions I had was, you talked about meetings and that there's been all these meetings. The website doesn't include any minutes since June. So, Dr. Nee, when you were here, we met, I think it was sometime in June. I mean, we didn't, so there's no minutes on the website since the last time you were here. So I'm just curious if those meetings occurred, one, where the minutes would be, and two, if you could tell us what's been discussed, especially at the most recent meeting, and whether any of these topics that we're talking about now and the towns and people leaving have been discussed at
I'll speak
your level.
to the website, and then you can speak to the other piece. The minutes were just approved at the last meeting, so those are about to go up. There were no actions taken, so we didn't have to rush to do that, so they did the approval of the minutes. We have a brand-new website, and we just switched again from .us to .ct.gov, which has, I'm now learning, because I'm a public health person, not an IT person. Whenever you have to migrate data on a website, sometimes there are some glitches. So there were several pages that some of the data was missing. So they're repopulating that. Our communications coordinator told me that she's hoping to have that resolved by the middle of next week, so that should all be current. And they're going to have the old Pomperog minutes and agendas up there as well when they're finished.
Could you circulate to this body all minutes since June?
Absolutely.
As well as both of you mentioned various documents that you said, oh, we'll send this to you if you want. I mean, if there was any documents or emails or anything that you think you want us to see, then send them to us.
Great.
Yeah, see, not working.
Yeah, yeah.
The last time, I think it's probably for both of you, the last time you were at Dr. Nee, one of the things we talked about and wanted to have an understanding of was the reason for the merger. I mean, that's really not the right term, but for lack of a better term, the reason for the merger of all the entities, the creation of the Housatonic. And, you know, one of the things that's been talked about, and that was talked about here about a year ago when you guys came and told us that this was happening, was that there would be, you know, all these increased services and benefits to the towns and whatnot. And one of the things we had asked for was some sort of presentation or summary of what these things are. What are the things that have happened over the last year that have, you know, occurred, been enhanced, gotten better, whatever, for our town?
Sure. So first, I would direct you to the annual report that we had circulated a few months ago, that is also on our website, which actually talked about all of the services that we accomplished, and a lot of them were post New Milford and Washington joining. Just to give you some highlights, I know typically we used the volunteers to do a lot of the vaccinating in the clinics, which was smaller clinics more frequently. We actually were able to expand that so that we were able to do clinics for staff before school, and then after school we did families, and on the weekends we did families. We staffed clinics with anywhere from 3 to 10 nurses, with volumes in 2-hour periods. We were pushing through upwards of 250 to 300 people to get vaccinated with very little waits. So those were some very impressive clinics. We also expanded case management services for families, like I said, who were having a family member who had COVID-19 and they were dealing with either quarantine or isolation, providing expanded expanded services to all of the schools. And as you know, Region 15, we share with Middlebury, so coordinating with Torrington with that piece, but really being there for our schools and helping them navigate the ever-changing guidance. And I know if you guys are like me, it felt like every 3 days you were waking up and it was like, okay, with 10 days, 14 days, 3 days, well, 5 days, but there's test and stay, but if they test every day, they can come back, and really helping the schools navigate what that looked like, and the same thing for business owners, and really being able to churn out documentation really quickly for that. We also did expanded blood pressure clinics. We started the diabetes prevention program. We were able to expand that. We also had a mental health program that we launched off. I don't know if you saw that, but it was really well received, particularly by the seniors, and the Southbury Senior Center was one of our main sites for really recruiting people for that. And they really helped seniors with kind of re-emerging back into, you know, the real world after COVID-19. A lot of things that we saw, there was a lot of heightened anxiety, particularly around after going through isolation and really being at home, out of public, to say, now it's okay to go back, and you can go back without your mask, and you can be in public and do these things. A lot of people had a lot of anxiety with re-emerging, if you will. So our nurses did a lot of programmatic work on that. They actually were so great at it, they actually presented at a national conference on a model practice because it was so well received, and it was identified as something that other health departments could implement as well. So that was really exciting. I heard our chief sanitarian, Mr. Joseph Kometz, who's sitting behind me, talk a couple of times over the last several weeks, and really saying for the same per capita rate that we were charging before these two towns joined, we have 2 more full-time staff, so that are doing septics and food. So particularly to that, and Joe, I'm sorry if I'm speaking on your behalf, but he was saying that, you know, for many years he was the only sanitarian, and for the same exact per capita rate that the town of Southbury is paying, you have 2 more sanitarians doing that work. Right now, today, as I stand before you, in our community health team, so before the 2 towns joined, we had 1 full-time nurse. Now I have 7 nurses on staff because of the expanded availability of grant funding that we're able to get, because the larger the population base, the more funding allocation that you do get from the state for, like I said, for a lot of that community health work, tongue-tied, specific to COVID-19 and a lot of other emerging infectious diseases. So there was a lot more work that can happen. It gives us better coverage. It allows us to be more responsive, particularly after hours and weekends. I know myself, as well as our community health staff, we've called people back on weekends who are having emergencies. I know that, not to bring your professional nature in, but Dr. Nee has called me before because we have residents of Southbury who are looking to get a vaccine, and we need to get them in somewhere. And I would also call to your attention that we are a safety net service provider, so if someone does not have health insurance, or if they're underinsured, because of our base now, we're able to provide more services, either at a sliding scale or no scale, if people are underneath that, and they're really significantly below the poverty line. And those are some of the benefits that we have now. And I know that back in March, when we were reevaluating and taking a look at how we deliver community health services, we really put a focus on making sure that we had affordable services for families as safety net service providers, and really expanding in what are the gaps and what should we be looking at, because coming out of COVID-19, more and more families are finding themselves in positions where they're dealing with housing insecurity, they're dealing with food insecurity, and those are silent things that you don't really know about until they show up at the health department, or we get a referral from social services, or we get a referral from the senior centers.
So you gave some statistics there. I'm just curious, how much of that was specific to Southbury, or was that specific to Southbury?
So if you wanted to see the exact numbers, we can check the annual report if you're looking for it. So you want to know how many COVID vaccines were for Southbury?
You said there was like 250.
Per hour. That's how many people we move through a clinic. So I don't tally for each clinic, like to have the numbers in my head, but if that's something that you want to see, how many people per clinic, I can go back to our nurses by day if you like, and see if they can put together that data, but it's not typically something that someone asked me to report on.
To my point is, we are specifically asking about how this has improved the services to Southbury. I'm sure the services have increased, and there's been a lot more stuff done because there's 2 more towns, one of which is almost over 30,000 people. That certainly would add to those numbers. And I think the question is, what specifically has improved for Southbury on that?
We have increased utilization because we have increased capacity to provide those services.
Right, but we've also doubled the size of the health district.
Right, yeah. I'm looking at your annual report right now. Yeah.
So I'm sorry, I'm confused. So you're saying that because we are a larger health district, that you're not getting services? I'm confused because
But
I
I
went
think
through-
what he.
I'm not saying any, I'm just asking questions.
No, I think that the question would be is, so if the residency increased by 50%, I'm just making up a number, and the nurses increased by 30%, then it's actually lower services.
So we went
like
from one paid full-time nurse to having, right now, we have 7 nurses. So even if we're talking by scale, by adding 30,000, that's still more, because we had a health district of 50,000 with 1 nurse, and now we're at 70, just about, I think it's just about 77,000, with like 7 to 8 nurses on a day. So to your point, yes, that means that you can increase capacity, you increase efficiencies, so you're able to get a lot more work done. So as I was saying to a colleague when we were talking about, some of the work we're doing and why we're able to get the numbers that we do, it's because instead of having 1 nurse and 3 volunteers, I'm able to have 5 paid nurses and 3 volunteers, so I have 8 people at that clinic, and simultaneously, we can run another clinic in another town or across town at the same time with that same staffing ratio, so we're able to get more people vaccinated during the same block of time.
So can I ask something about those numbers? What I'm hearing you say is that the Pomperaug Health District, the original health district, did not have enough nurses on staff and wasn't getting the job done?
No, I'm not saying that at all.
So they were able to get more done with fewer nurses?
No, I'm saying that they got less done with the staff that they had, and it was good. They did great. No, I am not disparaging Pomperaug Health District whatsoever. I think that it was phenomenal work. What I'm saying is, because we are larger and we have access to more funding and other relationships now because of that, because when you're part of the grant community, you get technical assistance from national organizations. It allows you to provide a higher quality of service with more funding, which means that you have access to more staff. And by rights of that, that means that you're delivering more to your community. So that's what I'm saying to you. I'm not saying that I'm not disparaging Pomperaug. I'm not saying they didn't get it done. What I'm saying is that we saw a benefit through this.
Where's all this staff located?
So our community health team, they're everywhere. So if I need them in Southbury, they're in Southbury. If I need them in Woodbury, they're in Woodbury. If I need them in Oxford, they're in Oxford. If I need them in New Milford or Washington, they go there. So they go where they're
What
needed.
determines where you need them or why, or what are they doing at a particular time in a particular town?
It's based upon what the community needed. So I'll give you an example. So late spring, we're coming down off of that last COVID piece, and there was still a huge push to get COVID-19 vaccines. So I had them doing COVID-19 vaccines because that's where we needed to be. This summer, we had to pivot because we had monkeypox, and next thing I know, we're fielding lots of monkeypox questions, and we're doing monitoring for that, and the same thing with Ebola travelers. So I had them in the office or working remotely, answering phone calls, calling people back, responding to emails, making sure that all of our community partners, as well as the residents, knew what they needed to know to move forward. Then in September, COVID-19 vaccine, and threw everybody for a tailspin, because that meant we had 2 ramp-ups simultaneously because people wanted both vaccines. So I had teams going to all 5 towns, before school, after school, going to senior centers, doing drive-throughs, so they are wherever it's needed. Southbury, as you well know, has one of the oldest per capita populations in the state of Connecticut, and because of that, we have the greatest demand typically for flu vaccines, particularly the high dose, as well as COVID-19 in Southbury, so we have a lot more volume. So our clinics in Southbury, particularly the late afternoons, we tend to have more people there. So if anybody came to I want to say that's Tuesdays, I believe, is a Southbury, like that rotation day. It was pretty full if you came there in September and October, because that's where we needed a lot of density with nurses. So
Report, and I'm seeing that the sources, these are people served by Connecticut Department of Social Services by town, but I'm not really seeing any data here as to what Housatonic Valley Health Department services by town. Everything that I'm looking at is coming from state numbers, and I'm not seeing.
Would you care to show me the example you're talking
Yeah,
about?
absolutely.
Because a lot of them, sometimes it's because that's who collects the data.
Sure.
So if you're familiar, like if you're looking at COVID-19 reporting, right? So the state is actually the authority who collects all of that data, and they make the data available to health departments. And I don't know if I've mentioned this here before, but I'm an infectious disease epidemiologist by training. And one of the big deal things is that you actually have to cite your source. And since it's their data source, we have to cite the source. So it's our resident populations that we may be pulling data from, but they own the data, so we have to give them the appropriate credit for that. Same thing if you were looking at our COVID-19 or influenza reports, we don't own that data, the state owns that data, as does the CDC, so we have to cite the appropriate source.
So where I'm going with this question is, so like, for example, I'm trying to understand, like, what is the health department doing and how much of it is in Southbury? So for example, this is just the page that I scrolled to. So we're looking at accidental drug-related deaths, injury by city and drug type, right? So this is listed out here. What I'm trying to get a better understanding of, how many of these types of cases is the health department involved in? So I realize, like, there's Campylobacter and all kinds of other things going on here. How many of those are cases that you guys touch? And how do we know what the utilization is?
First of all, I touch nothing.
Well,
okay?
I mean, I don't mean
No,
physically,
No,
but I
no,
mean.
no, I'm talking
yeah.
about even, I don't do the day-to-day.
Yep.
Okay, so, but I know if, let's say in the hospital, I have somebody who has Campylobacter or Salmonella, then that needs to be reported to the state, and it takes then it goes down to the local level. the local
I have
public.
chickens. I know all about.
Yes, you know exactly what I'm talking, so you understand, so then that's passed off to the local health
And
departments.
then we do the management of all
Right.
of that, so all of the follow-up that's associated with that, so you just talked about Campylobacter, all of the interviewing and the case management to make
Right.
sure that they're not working in a field that would be restricted while they're still symptomatic, we would do all of those pieces. So that goes back to what's considered reportable health conditions, and that's how that really gets broken out by that piece. And there are other things where we don't necessarily have a direct patient contact with them, but we have to do what's called monitoring. It's one of the essential services of public health where we have to do monitoring and advocacy work around that, and really working to see how can we help shape policy, and even if it's not something within our organization, working with community organizations who are doing that work and advocating for funding to come into the community, or advocating for more exposure, meaning that a lens being placed on something that needs additional scrutiny at the state or federal level.
Okay. So is there a report out there, and there might not be, I simply don't know, that actually gives us data on your involvement with our residents?
For what type of data would you like that on?
So basically, when I'm looking at all of these types of things, right, so like selected mental health indicators, things like that, like, my curious question is, I would like to know let's say for any particular ailment, whatever it be, you actually interacted or managed 22 cases in Southbury, 60 cases in New Milford. Like, is that data out there to know what you, I don't mean physically touch.
And it depends on, like I said, it depends on the condition, because there are some things that require us to make direct contact and manage, and other ones we don't. So I don't call every single person that has had a heart attack or has been diagnosed with, cardiac heart disease. I don't. But it is my job to know what the changing trends are, and then to advocate and implement programs that work on things like that. So when we talk about like our programs like Matter of Balance, that really is driven by falls data. So when we look to see how many falls and what the hospitalizations look like for falls, then that means that we have to work with the senior centers and the social services. Do seniors have what they need to age in place well? Are we working with the legislators to advocate for more funding for that? Are we looking at the housing condition? What is driving that data? Working with the local hospitals on the community health needs assessment, working with them on the community health improvement plans, or all of those pieces. So it really depends on the data indicator that you're looking for. And if you're curious, I'm more than happy to send you a copy of the 10 essential services of public health and how they're measured, so that you can see what each one of those indicators look like, so you can have a better understanding of all of the things that go into public health. I think that would be a really great conversation.
I think it would be, and I would have loved to have heard this 6 months ago.
Jason, you have more?
Can you discuss the staffing of the Southbury office, how your Southbury office works?
Sure. So on a day-to-day, we have our office manager there, then we have another person answering the phones. The sanitarians, the same scenario, they're in the field. If I had sanitarians in the office, I guarantee you everybody would know about it because they would be very angry because nothing would be getting inspected. Our community health nurses, our nurse supervisor is in the office as need be, but for the vast majority of time, all of our community health staff, again, they're community positions. They have to be out in the community doing their work, and that's typically where they will be. For myself, I split my time typically between New Milford and Southbury. I'm in New Milford 2 days a week, and I'm in Southbury 3 days a week. Any specific
Are
questions?
those the two offices in the district, Southbury and New Milford?
Those are the two main offices, Oxford, Woodbury, and Washington. The sanitarians visit there as appropriate to do their office hours there.
Okay. And then all the nurses, you said there's 7 full-time nurses?
Nope, I said that we have 7 nurses on staff. So they're a combination of full-time, part-time, and per diem.
Okay, so when you compared it earlier to Pomprog only having 1 nurse, how does that?
One full-time nurse, yeah.
How does that compare? So they had 1 full-time nurse. Did they ever call on other staffing to come in and supplement? Or
So they
any-
used volunteers, which we do as well.
Okay, so they had 1 full-time nurse and they used volunteer nursing services, people that,
They used community volunteers, so people
Okay.
from the community who love the work enough to volunteer
Got
their
it.
time.
and you have 7 nurses on staff, but that's not
A full-time
That's not
equivalent.
full-time nurses, that's when, as needed or whatever, or you're designing them
So
to
when we
clinics
say
or
they're
things like
not
that.
full-time, so some of them are 25, 30 hours a week, and like in a given week, we could easily do 200 hours between our nurses. We can do 300 hours, it really depends. So again, situationally, so in September, most of the nurses were working almost full-time hours because that was a demand to get the work done. I mean, I think I said it at the board meeting, in less than 6 weeks, they did 3,000 vaccines. I mean, that takes a lot of nursing hours to do things like that. And that's not to say that every day that we need to have 8 people on staff, but it really, like I said, it's driven by the need. So we try to respond and be flexible to that.
Thanks. No, I'm just trying to understand the staffing. I think the only other question I have is something we've asked you, I think, on 2 prior occasions, so I'll ask you again tonight. What is the district's intention with respect to its Southbury location?
So we own our Southbury location. We plan on staying in our Southbury location. I mean, unless Southbury elects to leave, because then we would not be able to operate as per state law. We wouldn't be able to maintain a physical presence here. That we've always had a brick and mortar, and I don't see why that would change.
So one of the things I'll just share with you is a frustration that I think a number of us have had is each time we've asked that question, it's always been responded with qualifiers. This is actually the most direct answer you've given to the question over the last year. The 2 prior times, it's been, well, we'd like to stay in Southbury, but we'll see, or, we're gonna have to evaluate, and that's like always been one of the things, and I'm talking from before all the stuff happened with budgets and whatnot. So that's been one of the things that our body, I think, has had some concerns about because we would very much want to ensure that we maintain our Southbury presence, and we want to understand that there's a commitment, whether with Housatonic or somewhere else as decided by the town, that there's some sort of presence here.
So I just want to say, and please don't take this as argumentative, but I know that I personally have never said that there was a question about us leaving. And I was here with our board chair the first time that I came, and she said that there's been a brick and mortar and that there'll continue to be a brick and mortar. I know that at one point, I did read in the newspaper that there was a question that we were leaving and selling the building, and it was the first time that I had personally heard that. But there has never been a conversation at the board level or with myself about us leaving Southbury. Like, it's never been a question. Like, the only time that I can tell you definitively that it was discussed was in the context of if Southbury pulls out, what are the legal ramifications for the health district, Lisa, in regards to our physical space? That's the only time that I've been engaged in a conversation about not being in Southbury.
So let me ask this question. You've said that, stated here, yet you did look at other real estate. You did approach another commercial owner about possibly moving in and renting their space.
In Southbury, down the road, literally.
Why would you rent space when you owned the building?
I'm more than happy to answer that, because we were doing a market analysis to see if it made more sense to renovate our space that we were in, or to go on the market and look to see about renting or purchasing another. So we actually, and again, I don't want to sound argumentative, but we actually looked at 4 or 5 spaces in Southbury, all within a half a mile of our current location, for that reason, because the question was, if we want to expand and talk about expanding clinical services in Southbury to include exam rooms and possibly a negative pressure room, would that make sense to do it in our current footprint or go to another footprint within Southbury? But that's not leaving Southbury, that's looking at future growth of services in Southbury, considering the population that we serve in this area.
Was there, you did that analysis?
And so we went and we looked and we got numbers back and quotes on what the square footage price and pieces like that. And then that was placed on hold. And Dr. Nee, if you want to talk.
I'm trying to remember how much we estimated it would cost over a 10-year.
Yeah,
It was quite a bit of money.
Yeah, it was almost $10 million over the 10 years. So then the decision was that we would stay in our current footprint and then continue to re-examine at the changing needs. And if that was the case, there was an office next door to us, and we said we can continue to evaluate if that was a possibility, because that was vacant, and that's where that conversation has been.
Do you know what your current mortgage is on your condo in, here in Southbury?
I do.
How much is it?
The balance on the mortgage or the current payment?
Balance on the mortgage?
The balance, I'd have to double check off the top of my head. For a month with the, between mortgage and the common fees, just under $2,000 a month.
But you don't know what the mortgage balance is?
Not off the top of my head.
Okay.
Would you like me to email that to you tomorrow?
Actually, I've done the calculation. April 4th of 2013, there's a 40-year mortgage on the property for $225,000. Amortizing that over the period of time you have it, the balance on that mortgage will be about $191,000 that's owed on that. The value,
Purchasing it from us?
well, actually, one of the other units about the same size recently sold for $52,000. And there's another one on the market, about the same size, for asking price of $99,000. I think, Justin, you sold the
I sold the 52,
52.
yeah, last week. It's smaller. But, you
But-
know, sellers have their motivations, so.
So I would beg to say that probably there's a larger amount owed on it than the value of it, what it would sell for today.
So I take it that means you're not interested in purchasing it?
Well, it was just interesting that that may have been part of the factor of moving or renting someplace else, because there, I think, would be about $90,000, $100,000 loss on the mortgage that would have to be paid off in order to settle that. I'm surprised that someone running the health department wouldn't know about what the balance is on the building, and that wouldn't have entered. Again, this is my problem with, what I'm seeing is a problem with the financial acumen of the health district and the people who are on the board of directors.
So I would like to say that you actually asked me that question. You didn't ask anyone on the board. And I'm sorry that I don't walk around with the mortgage balance, but that's probably because I'm a public health expert, and I do the budgeting, but I don't check the mortgage balance all the time. And we do have a team of people do that, and as a part of that process, the board actually they brought in someone to take a look at that and to look at our options and to explore what that might possibly look like as we consider future growth. So if you did have questions about that, I would implore you, as well as the rest of the board, to please, submit that to the board of directors so that they could formally respond if that's a concern of yours.
So what was said in Woodbury the other night, I was there and listened to it, it's on the record, that if Southbury was to leave the district, one of the ways they were looking to offset possible increases of cost per capita by the percentage per capita that we would be taking out of the district was by selling this asset and offsetting some of that cost. And I actually would argue that selling this asset would cost the district money in order to satisfy the USDA mortgage. Any other questions?
It
Yeah,
just reminded me of something as you were talking on the budgetary aspect. I know our finance director and Board of Finance, whatnot, has put together various budgetary issues that's been presented.
I hope it doesn't
to-
include the 48,000, because that still has me nervous.
What's that?
I hope it doesn't include the 48,000, because
I-
that part still has me a little nervous and confused. I'm not quite sure about that one.
I'm not asking any
Oh,
questions
okay.
about 48,000. My recollection is one of the budgetary, because we're heading into, at least for a municipality, we're heading into budget time. I think you guys are sort of on a different schedule, but usually we do have your budget by February for our budget meetings. One of the issues that was presented, I believe, was revenue estimates
Correct?
for the other towns. And now that, you're a year into it, is that concern being addressed in your budget makeups, and how, and have you learned anything from any of the issues that were presented?
So as Dr. Nee already had intoned, so our budget for the upcoming fiscal year starts on July 1. And on July 1, all 5 towns are paying, the businesses are paying the same fees. So I believe that answers that question.
No, that answers the fee question, the amount, the dollar amounts that each person's charged for something. The revenue estimate, and obviously, I assume the revenues were a little lower because the fees were lower, but the services may be different in the different towns. So there's other things that factor into the revenues.
So-
I'm just curious if there's going to be any impact on the revenues that would have an impact on the budget, if they're going to increase at all, or how that's all looking at this stage. 6 months in.
Yeah, I think you're talking about the estimates of the services out of New Milford and Washington. That's what you're talking about?
Right, because I think you had
Because we-
actual numbers for
Yeah,
ours.
so we have to look at the actual numbers for the end of the year, and I think that's what he's asking about. I don't know if we have that data yet.
So we have it through now, so.
Yeah.
So that piece, and like I
Did
said.
tracking higher or lower, do you know?
So we have, if we're going backwards, I think I understand you're asking me. So the actuals per category that we were tracking for the original 3 towns in the district, now we have those data points for New Milford and Washington. Yes, we do have that information, and that's included in that budget estimates.
For
Have-
next year?
Excuse me?
When you say it's included in budget estimate, you mean going forward, or?
For July 1, for the fiscal year ending '24.
Okay, the budget you're putting together now?
Correct,
For next year?
correct.
And are those numbers higher or lower than the revenue estimates in the last budget?
I want to say, for Washington, pretty similar. It was pretty spot on. For New Milford, a little bit higher.
Okay.
Do you know where your revenue projections are year-to-date? Are they close to what your projections were?
Yes.
Any other questions to the board? Okay, thank you.
Thank you.
Thanks, guys.
Next up, public comment, limited to 2 minutes. If we could have any public comment, you could come up and make a public comment. Any public comment? Any public comment? Hearing none, we'll move on to announcements and correspondence that you have in front of you. You have your reports. We're on to the consent agenda. Can I have a motion to approve?
So moved.
Can I have a second? Second, John. Thank you. Any discussion on the consent agenda?
On the, just a quick question on the police officers. So this brings us up, when we hired 3 tonight, that brings us up to 23?
Frankly, yes.
Okay. And are we, always asking about what we're doing for hiring for police officers?
We're still
What-
looking.
what are
We'll
we
get through
doing
this.
To get to, okay.
Yeah, we still have a budgetary number. We are, frankly, there's more than likely going to be some retirements in the next year, 2, 3, whatever it is. So yes, we're not slowing the process. We just want to make sure that, I've always said this I've always said this, and sometimes it's politically painful and difficult, that we, with our police officers, not that we do with other employees, but certainly with our police officers, we will make sure that the pool of applicants that come in If there were more that we, I mean, this time we brought 3. If there was 4 that we felt were, I don't want to say worth coming to Southbury, but that's what I think is we would have done that. But 3 were there. This was what, I do not want to fill slots just to fill slots unless it, I mean, I know this board would never suggest that. We've done very well with our community officers and how well it's been shown how well the process has worked and what they've done. So no, I do not want to, we'll go back out. We may take a little bit of time and let the next, there'll be another group. And I'm also sure these 3 officers are coming from 3 different, they're laterals. The word is out. Southbury is a good place to work. So I think we'll be doing some more of that. And of course, we'll put somebody, if we find a good candidate that would be wanting to come here and is not a certified officer, we would consider putting them through the academy also.
Great, thanks.
Any other discussion? All in favor? Aye.
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 Any opposed? Any abstentions? And it carries. Minutes of December 1st, 2022 regular meeting. Can I have a motion to approve? Can I have a second?
Second.
Any discussion on the minutes? Hearing none, all in favor signify by saying aye. Aye. Any opposition? And it carries. Next up, under unfinished business, health district options. I'd asked John here to go over the numbers and what they mean and what they could mean with possibly our options, which John has been working on with Dan Colton.
You get a hard copy, and that is what we're going to be talking about. Let's start at the end.
Thank you.
On, press, how do you like that? Let's see, a health district has fees, they do fee for service, they have a cost structure, and anything that isn't covered by the fee for service is covered by a per capita, which covers the bookkeepers, the accountants, the lawyers, the insurance, the rent, et cetera. So down at the bottom here is a summary of economics. We did this for the Board of Finance because you received a memo from the Board of Finance which Monday night unanimously referred to you the memo that was written by Jeff, myself, and Dan. And I think we encouraged you to adopt it with the understanding that we believe the economics should not stand in the way, the difference in economics between the various options should not cause you to stand in the way in providing the best service for the town. Service is first. But this is your decision. It's above our pay grade. But if you were to ask us, we think we ought to do something different. Betsy, can you make that just a little bigger? Because I want to. Ooh, that's a lot bigger. There you go. Down here is a summary. The Newtown Health District, because we were considering. We are in discussions with Newtown to see if there's a path forward for us. And we have no commitments from them. They're given a very short time frame to address our concerns. Personally, I don't think it's likely that their board is going to be able to decide in the next 2 weeks whether or not we're going to be invited. It may happen, but I don't know. But as a benchmark, the Newtown district per capita, it was at $16.28. Now that's what's left over after they hire people, do work, get fee for service, get grants, and the rest is the per capita. If Southbury were to reconstitute our district alone, it would cost us $24.95, which is this number right here. That is based upon this cost structure. I have had the opportunity to review this cost structure with the Woodbury Board of Finance chairman and another member of their board, an engineer who understands this stuff, and Dan, and we feel for planning purpose, directional purposes, this is probably right. But we have never run a health district, so this is just our best guess. A director of health with 40% extra for benefits, a APRN to provide shots and travel services, a sanitarian, and these are the current rates we understand in the marketplace. These people are hard to find, but not impossible, but they're very expensive. Then there are allocations. We believe one person to do the accounting, the billing, the Medicare, and the secretarial work in the office, a $60,000 person with those two responsibilities would cost this much. Then we have the general expenses. The Pomperaug Health District, if you look at their Pomperaug Health District, if you look at the building where they now are and what they paid for lawyers, accountants, mortgage, all the stuff that goes into general expenses, this was the full load, $119,400. That came from their financial statements.
Sorry, that is their total cost for all the towns right now, right?
This was the total cost for running the health, I'm sorry, you're,
Cumulatively, this isn't divided amongst towns. This is
no,
their total
this is the
cost.
total Pomperaug Health District budget.
And can I just ask, that 119,400, is this since they moved from having one full-time nurse to up to 7? Do you know where that benchmark
This is
time
not
was?
labor.
Okay.
These are all the general things you have. They had a mortgage payment.
Understood.
They
Sorry.
have workers' comp insurance. They have lawyers and accountants. They have bookkeeping services. There's a whole list in their report. And rather than parse it, I said if we went on our own, that's probably, if we had that same office, whether it was just us alone or whether we had 1, 2 partners, the general cost of running the office, probably without the non-personnel costs, would be about the same.
Right, right. So I was thinking, like HR, it's what I do, right? So the more people we have on workers' comp, it can go up, stuff like that. But I guess it also has to do with how many folks are using a certain space, would one full-time nurse use the same amount of space as, say, 3 nurses? Like, how would that, would our space needs change? If we were a smaller district, therefore having less staff, would we have similar space needs, do you think?
I can't answer that.
I
Fair
think,
enough.
Aren't you, what you're talking about here is overhead, just building the structure.
Yeah,
And then that's the cost of what it costs to do business. Then what we do to, add more nurses or add more staff, then it's, that's your multiplier. But
I suspect that's true.
overhead,
I've
setting
never-
up a business is there.
I think what John is doing is he's working off the Pomperaug Department of Public Health, the original budget that included the 3 towns, which we had heard gave very good service to the 3 communities. That's what we heard here. They were operating. And John is, I think what I'm hearing is basing it off of their budget that they had.
We have nothing else to go by. All we know is when we were in a district, that's what it cost to run the office, the non-people costs to run the office. It might cost significantly less. If it's only 1 town, we would get a smaller space and it would cost less. So I think this is an upside high cost, because when the Board of Finance wants to look at this and tell you guys what we think, we're going to have a rationale for it, and this is trying to explain that, okay?
No, you answered my question.
So the the labor, the benefits, and all the other costs to run the district, we believe would be, what's that, 623? I can't see it without I don't wear glasses anymore. And then this was the fees that Southbury received, this was the fees that were billed to Southbury residents, contractors for site services and restaurant inspections and all the things we charge fees for. When we were in the health district 3 years ago, Paparag district. Would it be more in the future? Probably, but I didn't put any inflation in there. I just wanted to keep this simple, right out of existing financial statements. So the cost, net cost after fees would be, what, 496? Divided by our then population is $24 per capita. If we were to go to a two-town thing with Middlebury,
Woodbury.
Gee, I keep saying Middlebury, with Woodbury, don't listen to anything I say. Yeah, just know that Woodbury is the other town that we have been in discussion with. The cost to run the place, we think it'd be about the same for all this stuff. The 1, 2, 3, 4 full-time people, their benefits, and to run the office. So assuming it to be about the same, then Woodbury, when they were part of Paparag, had about $74,000 worth of fees that their town generated, fee for service. So the total, if they're just the two towns, we would have $422, we have a $201,000 in fees and a net cost of $422,000. Gross cost, less fees. And then we'd have a population of 29,000. Us plus Woodbury at 9,500, 9,900, whatever it is, and us at 19, that's 29,000. So that'd be $14 per capita. So if we were to join with Woodbury, according to this pro forma, and this, all these numbers are from history. They're not the current numbers, and they're not what next year any of these districts, but we think directionally, when you look at differences, this is a reasonable way to look at it. So, what some of the options, again, Newtown alone is $16. Southbury alone would be $24. Housatonic Valley, the documents we have that we're currently under is $12.78. I don't know if we can get it for $10.10, that would be great. And we should go back to that. If he was convinced that we're wrong, it's not $12.78. So I'm sure you'll follow that up with Dan.
We should get some clarity on that. I made a note, like, I pulled up our budget. You know, the Southbury share is
Yep.
200 from last year,
Yep.
which would be 1010.
That was our budget, but that's
Right.
not what they told us they required.
So I guess we
I
have to
try
look
to
at-
make this clear.
we have to
They
look at the
sent us
bill they sent, or-
they're sending us a bill for $254,000. We put in the budget 200 because in good faith, we thought the adjustments we had made to the budget were proper. They didn't agree. They told us no. And at the time, when we made the budget, the Board of Finance said, look, we realize they send us the bill, we have to pay it. And this was in April, I guess, March, April. The Board of Finance knew that we were putting in 200, which what we thought was fair, not the 254, which we thought was unfair, that they would, if they were reasonable partners, would accede to. But they said no. And there's enough money in the contingency account and/or the unassigned general fund to cover the $54,000. So that's not an issue. That was a tactic in trying to get them to accede to our demands. So,
Just a quick question.
Sure, please.
They said while they were here, they billed us at 1010, which is 200.
that's what they said.
But what we think their bill does.
Yeah, we have documentation saying this is 1278, which is 254.
We need to get clarity on that.
I think there's a confusion there, but that's a separate issue from this discussion about what are the cost of the various options for us. Let's see, what's this? What is this? The new health district, what's that? 1320. I've got 1320 some up here. I can't remember which one that was. We were so bold. This is a new Newtown Health District.
Back off from.
Excuse me?
Good, there you go.
There's another sheet here which takes the Newtown Health District budget and adds us to it. And they have not seen this. They have not agreed to it. It makes some assumptions, but if the budgeting practices follows the budgets we know about, it would be somewhere around 1320 per capita. And all these numbers are falling right into a very tight range, I think.
John, would that assumption be that Newtown's 1628 per capita, with us in their district, would drop their per capita approximately down to 1320?
Yes.
Oh, so Newtown would save money?
What we did was, yes, and that's good for them if they want to, but they are not committed to that. I don't know if they've seen this or not. And what we did was we took the Pomperaug Health District, we took the Newtown ones, we added them together with all the costs involved. We took out one health director and their benefits. That's the only economy of scale we did. And then we increased the per capita for the people in our district. Because when we did this, we thought that there might be our 3 towns. But in any case, it would significantly reduce Newtown from 16 to 13 if we joined in. Then we have the Southbury number, 1414, which I showed you here, which is based on this. The old Pomperaug Health District was 1012, which we just heard about tonight. And Torrington, we understand, is 570, or last year was 570. We haven't done a lot of research there. Torrington is very far-flung. In our memo, you could save a lot of money, but I'm not so sure that the quality of the service would be what you need with our sanitarian spending a lot of time driving between Oxford and Torrington and every place in between. But that is a data point that we thought was instructive. So as far as the numbers are concerned, the Board of Finance has looked at these and we said, given all these numbers and all these assumptions that Dan and I have worked on, Jeff is not building these numbers. That's not his forte. We think these are the numbers we should be looking at. So that's the numbers. Again, the Board of Finance position officially last Monday night was this decision should be made on service. Should be on service to the town. We think the difference between these numbers, going alone is a little pricey. It's about twice the cost of joining with Woodbury.
John, can you, I was at the Board of Finance meeting, there was a lot of discussion, and there were some that, I think we look at these numbers, I think one thing that the Board of Selectmen need to understand is how much of, in these options, we're talking Southbury, 323,663. If we were to go to Newtown, that's what Newtown, the difference, what I'm trying to get at is, was expressed by one member, you're not talking about a lot of difference that's not gonna move the needle on the budget much. It's not gonna be, it's not a lot of money differential.
$20,000, $30,000, $40,000 is not nothing, but it doesn't move the needle at all when it comes to the mill rate or the total. It is more in the absolute, but relatively it is an extremely small amount of money. And Dick Hill, who's a rather conservative guy, he said, these differences between these various options are small enough that the money isn't the issue. And we're here tonight to tell you that the Board of Finance is telling you, going on our own or going with, going with someone else, a partner like Woodbury, these options, and if we could get Newtown to talk to us, but they've got their own pressures, the money shouldn't be the basis for your decision. We believe there's enough money here, one, to do the startup if we go on alone, and two, on an ongoing basis, have a per capita which is in line with all these things.
What are our real-life options of these towns? So from what Ms. Morrissey said, it sounded like Woodbury might be on the fence. Is Woodbury, I mean, I don't know what your pulse is from them, how interested they are in reforming.
I had a discussion with some Woodbury Board of Finance members this week, and the two that were there believed that it's in the best interest of Woodbury to join with Southbury and do our thing.
Mm-hmm.
But they recognize, like we recognize, that it's not their decision. It's up to
Correct.
their Board of Selectmen. And I think their message to their Board of Selectmen is going, the two people that I talked to, was the same as our Board of Finance's message to you. You have to make the decision based on what you think is the best level of service, because the economics are not significantly different.
Except going alone is a little bit different. Southbury alone is a little
Well,
higher.
Southbury alone is pretty pricey,
Yeah.
because we
that's-
got all these costs to provide the same quality level of service. There'd be fabulous service with all those people serving only us. But even when we had a smaller space and part-time people, it would still be significant.
And the idea being, it is possible that for our first year going alone, it would be significant, but it is possible that some other towns might rejoin us down the road, as we've kind of got a well-oiled machine going here.
I can't get into that. I'd like to think so. Anything's possible. Is it probable? Certainly don't know. I don't know. I wouldn't want to lead you to believe that.
Right.
So if I
Yes,
could
John.
ask a quick question. So one thing that I think I heard Lisa talking about, and one that's missing from this conversation, is that economy of scale, but not as it relates to, using one HR person to cover 30,000 versus 60,000 people. But what happens when you put more people in a room and then go to Connecticut or go to the federal government and ask for grant money? And who gets more money? So, like, I was just playing around looking at, so I put populations next to these numbers, and it would clearly just make sense that Southbury, with 20,000 people going it alone, is gonna pay more because they gotta cover the overhead, and they're at $24.95. But once you start, adding Woodbury or the old Pomperaug Health District, and you get to 30,000 or 42,000 people, it brings you down to $14 a
Yeah.
person, or, per capita. The interesting anomaly to these numbers is Torrington at 35,000 people, and $5.70 is like, just doesn't make sense. So, you type of thing, like when you get a whole bunch of bids together, you throw out the low, you throw out the high, and then you
Yeah.
work with it. So,
John, I think the Torrington number is the district, and there are 10 towns in that district. So
the population might be
the population's
that much.
huge, so therefore covering the overhead is spread among a lot of people. That's why it's $5.70.
Right, but so going through the numbers and staying more local, instead of going all the way up to Torrington,
Yeah,
the current health district is covering, and if my math is right, or, plus or minus 75,000 people.
yes,
So when you go to Connecticut or the government, federal government, and with 75,000 people behind you, you have some pretty good clout. So that's when you can start, like they were talking about, the affordable safety net. And we never talked about any of this, is because of the size that the underinsured or the insured are being covered for health insurance through the health department, possibly. That's
Could be, I
something-
don't know.
So as opposed to talking about, is it $10, is it $11 or $12, are we getting health insurance for our seniors? The next question, I guess, is, we're the oldest per capita in Connecticut for Southbury. I think that's and we talked about it, I think, at one of our other meetings, where we're 26% of the population is elderly. If we went alone, and the higher percentage of seniors in our population is going to even make that cost possibly even higher, just because we're covering a different type of population.
And what would be higher?
Just the cost of covering needs of an elderly population versus, the traditional population through Connecticut. So additional costs that we would be doing it by going alone or staying in a smaller population.
I am not aware of any logic that supports that contention.
Just knowing that we have a,
We have the oldest population in the state,
oldest-
relatively, no question about that.
right,
I'm not so
For
sure
the
that
needs
just
of-
because they're older, it costs more to provide services. I haven't studied
yeah.
health districts across the
Yeah.
state.
So-
I'm sorry.
So to answer that, John, there's also, from listening to the health department speak in Woodbury, Washington and populations, municipal populations below a certain threshold qualify for rural grants. So Washington would, because there's so few people. Bridgewater, so it would assumption would be that the new town would not qualify, but Bridgewater would qualify for the grant specific to them. So,
If they were going it alone.
no.
Oh,
Even going with, and that's what was said at the meeting, that with all these towns, if the population, I think, was under, it's a rural population, just because they're Washington, Connecticut, which you would say is rural, but it's not poor, they do qualify for grants specific for that town through the health district, but the rest of the towns don't get it. So Southbury maybe, or New Milford may not be part of that grant. So you would still get grants according to those needs, but they would be distributed to that specific town with that that classification. So, and I don't think, a lot of our seniors are covered under, Medicare, retirement, and Social Security, and all that.
I just know I see a lot of, emails and posts and conversation just about, underinsured and not having the right coverage or enough coverage to cover needs. So if being in a larger health district would offset some of those costs, that's something I think would need
That's
to be
an
explored.
assumption.
It's not,
Yeah.
it's a
It might,
it's a statement
but I
that
don't
was
know.
made by the health department that there are certain advantages that we get as being 75,000 people compared to 30,000 or 40,000 people.
Yes,
I don't know.
I don't know.
And then the last one is just a jab, so I won't say it.
Okay.
So, I'm willing to stand here and ask you questions about this. And I think I think the point is well made that this number, if we were to get Woodbury to join us, is a lot less than that number. There's no question about that, because there are economies of scale, as John says, that comes with the larger you are. At some point, though, the economies go away. But
When is
So-
Woodbury making their determination?
they,
Monday night?
Monday.
they have the same timeframe we do.
So for my purposes, for here tonight, given that we don't have a set commitment or path forward, my assumption has to be, in any vote I make tonight, that we're gonna have to, if we leave the district, my assumption has to be that we're forming our own health district, because that's the only thing we have control over. So I cannot assume that we're going to join up with another town, join another health district, do anything like that, because that's out of our power. The only thing within our control is our ability to form our own health district, and we need to, provide the services to our residents. So if we make a decision here tonight to leave the district, we need to understand what the path forward is. And forming our own district has substantial cost. I understand the Board of Finance is okay with the cost, maybe not as much as some of the other costs. That cost, I think, I'm not so sure. I think you guys are hoping that we're able to join up with Woodbury or somewhere else, that we're not going to form our own health district. If I could read between the lines a little bit, because forming our own health district is sort of double the cost of what we're paying now. And I just don't know that that's reasonable, if it's necessary. And my bigger concern is our ability in a 6-month time period to build it and get up to speed and have it ready to go on July 1. So that's a concern I have. I don't have the same concern if we were to join up with Woodbury, which is something that we do have had partnerships with in the past. The costs are more palatable. There's economies of scale. We're next door to each other. I think working together over a 6-month period with all the expertise in that town and our town, we can probably, ramp up and get this going in a 6-month time period. So if we were, for purposes of tonight, like if, unfortunately we're here tonight, right? So we need to, to live in the reality we live in. And for purposes of here tonight, I would be uncomfortable voting to leave the district without a plan forward, because that means we're forming our own health district, and I think there's a lot of uncertainty there and a lot of costs there. However, I think if there is a way to navigate this, to join with Woodbury and fashion what we do here tonight somehow in those terms and in that regard, in advance of their meeting on Monday, I would be supportive of that, of leaving the district to join up with them if they were to leave the district and join up with us. If not, I think we need, me personally, would need more information and more ideas on the plans and the path going forward, or commitments from other towns or things of that nature. So that's sort of where my mindset is at the moment.
Justin, do you have anything?
A week ago, hello? Oh,
Yeah, it works.
wow. A week ago, I thought there was a very high % chance that I would be joining whoever else to vote to leave the district. Over the last couple days, there's been a lot of new information. We know Oxford is not leaving. In the discussions I've had with one of our counterparts in Woodbury after Tuesday's meeting, it does not sound likely that they are leaving either. We'll find out on Monday, I suppose. All that being the case, I do not like the idea that we're going to go create our own, not with a 6-month calendar in front of us. We know municipalities move slow, that kind of stuff moves slow. We know it's very difficult to hire right now. So I'm not comfortable with that concept. So if we have to vote tonight to leave, I'm a no as of tonight. And frankly, I thought a lot of the answers that we got tonight made a lot of sense. I wish we got them months ago. I agree with you there. But we're talking about the public health agency for the oldest town in Connecticut, which makes it one of the oldest towns in New England. And I think we have to be cognizant of all that and be cautious. I understand that we have people that have not appreciated our relationship, and I get it. Responsiveness is an issue. But at this point, with our path forward not being completely clear, and in one, the only clear one is, again, very expensive, and it requires us to do hiring, which may be very difficult in this current environment, so.
Justin, can I ask you if it was contingent upon Woodbury voting to leave the district and go with Southbury, would that be a consideration?
It would be a consideration, yes. Yep. I mean, from the get-go, I stated that I thought that we should have a physical presence in our town. And right now, that presence is Housatonic Valley. If we did have a way forward with Woodbury, Woodbury's close enough if for some reason we decided to have it in their town. Well, we'll see what they do on Monday, but that's where I am currently.
Would this board, can we propose a special meeting and table it till a special meeting and see if we can hammer out some kinks in the next week?
I think that Woodbury is looking to know that Southbury would leave the district
Continue.
with, that we would leave that if they would consider coming with us if we leave the district. We could structure a vote that would authorize the notification of the Department of Public Health and the Pomperaug, or the Housatonic Valley Health District, that we would leave if Woodbury is leaving with us. So in other words, that would give them the ability to take a vote, knowing that if they vote to leave because we're leaving, that they're covered, that they wouldn't have to go on their own. I mean, obviously, they're in the same thing. They don't want to go on their own because of cost and exactly this. But I think we could structure it so that if the board had the willingness to go with Woodbury, that's an option. That doesn't mean that during the next 6 months that we can't then go both of our towns, Woodbury, if Woodbury and Southbury do, to discuss with Housatonic, or with Newtown, the option of going in with them and expanding their base and reducing their costs in the economy of scale. I think, again, yes, I agree with you. Going on our own by ourselves doesn't make a lot of sense at this point. I'm also confident that, we have a lot of good people on the Board of Finance. We have a lot of good people on the Board of Selectmen, and Woodbury has a lot of good people that, the numbers that John put in for hiring people, I think are realistic, that you could attract someone to get them. I would say that for me, if I would look for Woodbury to go with us, and then also approach and start discussions with Newtown if they were to be amendable. There's a couple ways that can be done. You can contract base. You don't have to necessarily, you can contract base for the first year with someone to provide those services. You can do that. That may be something that they would want to do and try for 1 year with the two towns and then come in together to see what the numbers are. I think, frankly, that's what the Pomperaug Health District should have considered with Washington and New Milford rather than do what they did. But again, yes, I agree. Going alone, just Southbury, but I think I would be amenable to go as long as Woodbury was going along with us. John?
Yeah, I think I'm just going to recap. I mean, what we heard tonight, I think was a great presentation, a good conversation, a great starting point. I think it's by all means a little bit late, and we should have been having a more, graceful conversation prior than being, I believe we were a little bit aggressive on it. But because of the size, I mean, what I heard about, and it just makes sense, 75,000 people, it's the buying power, it's the, we're talking about going back to, 30,000 people, just 2 small towns, having 1 nurse, 1 sanitarium. We now have 7. We have now 3 nurses, 7 nurses, 3 sanitariums. It's a lot of support, a lot of backbone. I'd be proud to call Lisa Morrissey, our director, working in Southbury. I mean, with the aggressiveness and what she explained here is feeling pretty well beat up, she still comes here 3 days a week and spends more of her time and more of her commitment and more of the needs, is meeting the needs of Southbury. So, and at 10 per capita, and I love to, if we prove them wrong, then it's just what you've been saying, but I just can't imagine it. So I think we should be exploring and having some very cordial conversations and trying to open a new book and moving forward in a very comfortable team-like manner.
I personally agree with moving forward with Woodbury. I would also be eager to see if Newtown can come back with something before our final deadline. That would be ideal, is if we could have some plan. But ultimately, I still stand behind the statement that I made at our last meeting, that I feel like this was a hostile takeover of our health department. We built it. It was these 3 towns without, our knowledge really of what was going on. Unfortunately, my faith is absolutely destroyed in the health district and the leadership and administration. There's been an awful lot of opportunity for these things to be fixed. We're here every other Thursday. We're here twice a month. There has been plenty of opportunity to have these discussions. It hasn't happened. And I think our people deserve better than that, because that's part of the job. Part of the job in running the health district is communicating. And I don't see a pathway back for this. I feel, and especially to be said that hostility came from this board, I just think that's a misrepresentation, because there was not hostility from this board. We were all present in executive session. So I wholeheartedly support leaving the Housatonic Valley Health Department. Ideally, I would like to join with Woodbury if possible. I am also very concerned about going it alone, but I would love to see if Newtown would even just contract with us for a period of time, for a year or so, until we kind of figure out where we want to go from there. Because what I ultimately want to see are bylaws and requirements that this can never happen to the town of Southbury again. I want to see us in a position where such a merger could not happen to our town again, because this was an unnecessary turmoil, and I think that it could be reconstructed in a different way, so that there are requirements that prevent this from ever happening, so that future boards don't have to deal with what we've dealt with this year. I'm done.
So, like I said, I would be supportive of a vote tonight that was contingent on Woodbury's approval and Woodbury also leaving. And and just to be clear, any vote I take tonight is going to be with the understanding that we're going to end up, if that were to come to be, if the contingency were to come to be and Woodbury were to vote to leave, the premise of my vote tonight is that we would be forming a separate health district with Woodbury. Obviously, the town should consider whatever other options may exist, whatever they may be, and make decisions going forward. But for purposes of tonight and what we're doing, that would be my understanding of the vote that I would make. So I would be supportive of that. I would not be supportive of just voting to leave the health district. I think I have concerns about just the ability, like I said already, just forming our own and the time period and the cost and all that. But if we have a partner in the effort, I think it's really, I think it's feasible.
So for the purposes of tonight, and given the deadline, Jason, I agree with what you're saying. Of course, you're the person that can put the words together correctly. I agree. I would like to see a motion for discussion, motion made and discussed, specifically that Southbury vote to leave the health district contingent upon Woodbury also voting to leave the health district and going with Southbury at, and the direction we're, into a health district. Is that?
You want me to create that? It's always me.
You're good at this. This is your forte.
John, the motion's not on the floor yet, right?
But there's no motion.
Very
Yeah.
good. John, can you remind me, last meeting, did you ask, and forgive me if I'm misremembering this, but had you asked that if we notified the health district, could we change direction between now and June? Had you asked that? I thought you did. Like, if we gave them notice, could we then give them future notice that changed their minds?
We did not ask that to them directly tonight,
Which
and I
probably should have.
think it was, did anybody ask, or, because I
No.
think that was something we were going to follow up on.
Yeah.
The assumption would be that once we gave you notice, they would build their budgets for 2020, for July 1st, based off of the per capita without us in the district or us and Woodbury in the district, which is assumingly would also increase their cost.
Right, right. No, it's a fair consideration. I was just trying to recall if I remember that properly, and I think I did, and it probably would have been a good question to ask when we had them here, but I don't think any of us thought of it.
I did ask if we could hear from our attorney about that.
Okay.
Did we?
I did not get that question answered. And again, if we give notice, they build their budgets based on what they know. So it's, they can't get partway through to the year and then, 2 months before July, you can't say, well, we actually are going to stay, because they've already presented their budgets to the remaining towns. So I don't, I don't think you can pull out or change it after that point. Jason's been typing away on a.
All right, so I just edited the motion that we were all provided. Resolved that, I make a motion that the Board of Selectmen pass the following resolution. Resolved that contingent on the town of Woodbury providing notice that it will leave the Houstonic Valley Health District prior to December 31, 2022, the Southbury Board of Selectmen hereby authorizes First Selectman Jeff Manville to notify the Houstonic Valley Health District prior to December 31, 2022, that Southbury will be leaving the Houstonic Valley Health District effective July 1, 2023.
Do we want to add that it was contingent on them agreeing to join with us? Because I think what we wouldn't want them to do is go and join Torrington and then we're on our own.
That's a good point.
I think, Jason, you have to, and the notification also has to go, the primary notification has to go to the Department Public Health.
I just took the one that we had, so it should be,
Yeah.
you didn't write that. It's not Betsy's fault. All right. I
Technically, you
withdraw
have to-
the prior motion that I made. How about the contingent on the town of Woodbury agreeing to join Southbury in providing public health services to their residents and providing notice that will leave the Houstonic Valley Health District prior to December 31, 2022. The Southbury Board of Selectmen hereby authorizes for Selectman Jeff Manville to notify the Department of Public Health prior to December 31, 2022, that Southbury will be leaving the Housatonic Valley Health District effective July 1, 2023.
Is it July 1 or July 31st? June 31st? Is it effective July 1st? I guess it's the July 1st. Okay. Is there a motion being made?
So moved.
Second.
Made and seconded. I'll open it up for discussion. Can you, Jason, again, could you read into the record the motion?
And I'll email it to you, Betsy. Resolve the contingent on the town of Woodbury agreeing to join Southbury in providing public health services to their residents and providing notice that it will leave the Housatonic Valley Health District prior to December 31, 2022. Southbury Board of Selectmen hereby authorizes First Selectman Jeff Manville to notify the Department of Public Health prior to December 31, 2022, that Southbury will be leaving the Housatonic Valley Health District effective July 1, 2023.
Motion's been made and seconded, and we're in discussion. That's the motion. Is there any discussion on that motion?
So, I think it's gonna be a moot issue, but, I'm still gonna be a no on this, because I feel like we're putting one arm into the parachute and jumping out the plane, mainly because of that hard 6-month deadline that we have. I think if we really need to get away from Housatonic Valley, and I'm not sure it's an unfixable relationship yet, I'm not convinced. We should spend 12 months figuring out what it is we're gonna do, and have a very good option with no question marks attached to it about where we're going at that point in time. So I do appreciate the wordsmithing and the concept, but I'm still a no on this one.
Just doing what I'm told.
John?
So I'm going to throw in 2 little tidbits, one to honor my dear mom, who's no longer with us, but as my mom would say, we're cutting our nose to spite our face. We're going to be leaving behind more sanitariums, more nurses, more services. We're going to be leaving behind the support of a larger community. We're going to be leaving behind Director Morrissey, who is committed to Southbury and is here 3 days a week. We're going to be leaving behind less cost, for more cost, less services, less people. To me, it's a no-brainer to move forward and stay where we are, get our proper representation on the board of directors, and work with them in an amicable way. So, yeah, and also just a thought of, without knowing what the 10 essential health services are, I think we have a lot to learn before we even step out of that plane with that parachute.
Anybody else?
Oh, I absolutely agree with the cautions around leaving. That being said, we've built a health district with them before. I think we can do it again, but I really want to underscore that I want to make sure this never happens again. And there is, with the way that it is currently structured, we simply don't have the votes to restructure Housatonic Health District so that these types of decisions don't happen to Southbury again. And I don't see a way out of that now that New Milford will always have more votes than us. So unfortunately, I think we can do it. I think there's good people that have done it before. And if Woodbury wants to go this direction with us, then I would be a yay.
Just a quick correction, if we could. You said they will always have more than us. There's developments, there's affordable housing coming in, there's other ways that this community is going to build. We may.
They do too, though, right? They're growing.
Right.
They're growing
But
as well.
They're not on 84, they're not in close proximity. Anyway, I'm not going to debate how populations are going to grow, but we could be equal.
feasibly could be. They're significantly larger than we are now, and there's also a tremendous amount of interest in New Milford not being in New Haven County. There's, I'm sure Justin has some experience in real estate, but New Milford's pretty booming.
It's geographically huge. It's the largest town in Connecticut, so. But we can't really predict growth curves, so.
There's a lot of land to be bought still, and I would expect, I would reasonably estimate that they will remain significantly larger than we are.
No, like I've said, if we're able to do this with a partner, I think it's feasible, and I think it makes sense based on everything that's transpired. If we're not able to do it, if Woodbury's not going along, then I think our very next board meeting, the health district should be on the agenda, and we should be talking about everything we're going to do over the next 12 months regarding the district and our representation and the budgeting and monitoring and understanding what's going on, the best steps moving forward. And we need to be proactive about that in the next year.
So I want to be clear, there were some things said here about aggressiveness and animosity and what have you. I want to remind this board that we all had a good relationship in the start. We were told about how good things were going to be and how well things were and what we were going to do and how great this is. Our representatives told us a little bit, not a lot. What developed as we got further into it, my words to Lisa Morrissey was, we need to put the brakes on this thing before this goes through. And when the director of public health tells you, tough, that's kind of too bad, you have 2 days to take care of it. That's the first start of, wait a minute, I'm here having a discussion, I'm concerned. There was no animosity. In discussing with our board, the members on the board, obviously questioning, what did you know and when did you know it? John Michaels is always saying, what did you know and when did you know it? And then what did you do about it? I always remember what that John Michaels said to me, what did you know and when did you know it? And we never got clear answers about what they knew, which they should know. They should have known. They weren't paying attention for the representation of the people of Southbury and, in my feeling, Woodbury and Oxford, but certainly not Southbury representing. Things did deteriorate. I'll be the first to admit it. Extremely frustrated when I'm trying to talk to people and get things, and I'm hitting a dead end. I've had meetings here with all the CEOs of all the towns, presenting what John Michaels and the budget and what could be done. Fell on deaf ears. Something I said to people in Woodbury, to the leaders in Woodbury, when we were partners with Woodbury and Oxford, we never treat our minority partners anything less than equal. We never did. And they agreed. No, Southbury is always good. Always, there was never that problem. It's obvious we have a problem here. And every solution we bring forward, the CEOs of these municipalities that were here, sitting with us, discussing the frustration that we're having, one simple step could have been to say, you know what, we did join the district. We should equalize the fees. New Milford could easily have said, to keep this district together, let's start there and equalize the fees. The answer was, well, they'll be equalized when we get there. Why would you make that offer if they wanted to join us and it was a good deal? Why didn't you just say your fees need to be the same for everybody? If somebody joins our school district, another municipality, a third member, we don't say, oh, by the way, you're getting a better rate. It's equal. And if you want to know what my frustration and how it gets more aggressive or more upset, when I fall on deaf ears and I can't be heard, yes, I get upset. And what are people willing to not even discuss? This is my proposal. This was a proposal. We had done some financials. Explain to me why they're wrong. Or can we discuss it? And the answer constantly was no. Don't be disillusioned why we're here at the 11th hour, a deadline. Woodbury asked for draft audit reports at the meeting. They are not going to be available, the report, audited reports are not going to be available till January something. Well, what about a draft, an approximate? No, they won't give them to us. That's not helping the situation. To me, that's telling us, let's get past this, let's get past December 31st, then we'll put it together. Again, frustration of why we're being treated like this has led to my frustration. And it's been another month, another month, another month. And it is continuing. I don't see this changing. And this relationship with this region, health district, I've asked, I've had a resignation. I've asked some people that I thought financially could come in there, financial people, because they have no financial people looking at these numbers. They've admitted they don't have people who look at the numbers, didn't know how to put the budget together. What have they done about that? And they do admit, Jim Brighton admitted, there is a surplus built in. Not is wrong term, they don't have financial people. I mean, we could go out and see if we can. I don't think we have representatives that have come here to even discuss with us. They should have been here when this originally started. They weren't. And essentially said, now it's done. Because they can do that. Well, I would be in favor of the motion because sometimes you have to admit that the marriage is broken. My fault. If you want to give it to me, and say it's Jeff's fault because that's what it was. But from the beginning, I had a good relationship. We all had a good relationship. But it deteriorated constantly, and it was to this point, the frustration. What do we expect by putting someone else on the board? Anything different? Any better reports? I don't see it. Do we put someone from the Board of Selectmen on, or the Board of Finance? I've asked the Board of Finance members, I said, does anybody would like to be on the, I don't think they can do that. There are Board of Finance members I know are ready to restructure this. And I'm sure that I'm sure, as we discussed, and Holly is correct, Southbury built a health district, a pretty good health district. For many years it served us. It took a pandemic, and make no mistake about what was going on. The health district vaccinated a lot of people. And it's also a revenue stream. But there was a lot of people vaccinated. I think the health district did a pretty good job of it, the Pomperog Health District. So could we build a health district back with Woodbury? I'm sure of it. I'm sure of it. We have the stability in our budgets to do it back with Woodbury. So is there any other discussion on the motion?
Yeah. I mean, I think what I'm hearing is that, you know, over time, instead of them moving forward and yielding to our, you know, questions and needs and wants, or, you know, instead of us being proactive and just communicating, possibly even offering some constructive criticism and conversation versus just critique. I mean, basically, you know, we've been saying it's our way or the highway, and now they're telling us, well, get on the highway and take off. But they've done a good, I mean, it seems that with just a short, brief review that they've given us, that they've been doing a good job, that they've been here supporting Southbury. I mean, just even now, again, we said, you know, they called it surplus, they called it profit, they called it some other terms that might not be something we use, but we use reserve, right? We asked them to put reserve in their budget. And what I'm hearing is, you know, is it reserve? Is it grant money? It's, you know, they have a different term for it. It's not our term. And they told us they're not going to use, you know, they have their terms. But I think, you know, to be a partner and work as a team, you have to, you know, you got to yield both ways. You can't just tell them it's our way or the highway.
I don't think anybody
I think
told them
we're-
our way or the highway. We made proposals, and they said no. That's not negotiating or helpful.
And over the summer, we had a very lengthy meeting with them, and we asked a lot of questions, and we left on very amicable terms, and I haven't gotten the answers to some of those questions, and I haven't gotten any reassurances since then. And I understand what you're saying about, it certainly sounds like there's an awful lot happening, and there very well may be, but to my points about their annual report, I can't tell from their annual report how many Southbury residents with each of these things, what is their involvement? And I don't have that answer yet. Like, how many folks with an ailment here were serviced by them versus in another town? The statistics that are on their annual report are state statistics, which I get, and that's maybe the way that the report is, but it's hard to say if it is hard to say with the information that we've been given, because we've been given so little information, if the residents of Southbury have actually experienced an increase in services since this has become the Housatonic Valley Health District. And I really don't have any reassurance that that the residents of Southbury have seen increased services. Certainly throughout all of these towns, but it's also a much larger geographical area, more drive time. It's huge now. How much have our residents benefited? And I don't have any reassurance of that, and we haven't gotten that in 6 months. And I have to take issue with the phrase that we imposed this deadline. And I'm really struggling with the presentation that was given, and I really think that was a gross misrepresentation, because state statute, under which guides them, limits us to December 31st. And I really, I take a lot of issue with some of I hate to say it, some of the things that were said to us tonight about hostility from this board, that we imposed a deadline on ourselves.
Well, we ran up to the deadline.
We have patiently waited to the deadline that unfortunately is state statute. We can't go past it. I mean, we've been here, and I can't stress this enough. We have been here, and quite frankly, if I were the administrator of an organization and I had the opportunity to come in for public comment, why tonight and not 4 months ago, not 5 months ago, when all of this has been going on? And I really struggle with that, because I just don't see how, the group that came in here a year ago and made us the reassurances that the district was still focused on the residents of Southbury can be MIA for a year, but all of a sudden it's okay to show up here tonight. One, it doesn't make sense to me. They couldn't have done it because of lawyers, but they can tonight. That doesn't add up. I just don't have confidence that that we will ever be able to. I will go on record saying that I do not feel comfortable that the Housatonic Health District, as it stands today, will properly represent the people of Southbury and give us the information that we need. And I think that my number one thing is to make sure that this never happens again. And I don't see a way out of that. You know, I am concerned, about, even to the point of, you know, the recusal with New Milford, how somebody who has a relationship with New Milford, a working relationship, and then joins us. I still struggle with that. This will never be Southbury, Oxford, Woodbury equal. It just doesn't seem that it's gone that way. And we certainly have not gotten the information along the way to make me feel any differently.
So I have had complaints in my office from engineers about getting their work done, getting their permits quick enough. I'm getting complaints. One of the other problems is they are not using our online permitting system and checking the boxes. Instead, they're faxing it over, and our people are having to do the entering all this stuff. I know that we are, in my estimation, not getting the services we were getting, or as quick or as well as we were before.
Jeff, has anybody asked them to not fax it and to use the online system? Do you know if that,
What's that?
has anybody asked them to not fax it and to use the online system? Do you know if they were asked to?
I'd have to go up to the third floor and see if but they should be using our online permitting system that we've put in place. The other thing I want to remind the board is, you know, it's you know, here in Southbury, we have CVS healthcare systems, Walgreens healthcare systems. ShopRite has a pharmacy and shots. I didn't go to a clinic. I couldn't go to the vaccine clinic because I had COVID and I had to wait the time. So when time period went by, I just simply went to the pharmacy, and they took my insurance and gave me my shot. We have a number of healthcare facilities that will do vaccinations and can get vaccinations and can do things. It's not like maybe Washington, I don't know if they have a pharmacy up there. I don't know if some of these, if Woodbury does, I think, have a pharmacy.
So you suggesting they should reduce their services and provide less just because people can go somewhere else to get it, or?
I'm just saying it's easily available, you know, and of course during COVID, if your insurance didn't cover it, it was covered under the government. There was a large revenue stream because of the vaccinations they did. They got paid for those. They get paid for administering vaccines. You have to give them your insurance card. And I don't think there's, so we do have that.
I mean, I almost think that if we just stay the course and do what we're doing and just work amicable with the folks who are representing us and make sure we have those monthly meetings or conversations and all that kind of goodwill, we'll be paying $30,000 less a year, which is 12% of our health district cost. So what we're saying is because we don't like some of these things and we're just a little inconvenienced, we're going to spend 12% more to go it alone with another community.
It's a minimal amount of money. It's not about the money. It's about the services being provided and how we are getting these services.
But you're saying we're going to have one less nurse, we're going to have one nurse, we're going to have one sanitarium, and we're going to go to CVS to get our shots instead of what the senior community, I know quite a bit of them, are comfortable with. They go to the health department, they get their shots, they've done it for years, they like doing it. We're talking about reducing services again.
I gotta tell you, I have trouble with the staffing comparison. So we had one sanitarian before, right? And then we doubled the size of the district and have another sanitarian. Just because there's more employees now doesn't mean that there's more services. There's double the people. So we just have to be careful when we have that sort of discussion.
Well, I agree.
I think a better analysis would be, under the old system, was it staffed appropriately? Was it understaffed? I don't know. We'll have to look at those things, but I think you gauge that by complaints over a long period of time. And over 30 years, all the years we served on this board, we never had, any people coming in and complaining about being able to get services at the health district. So I'm not sold on the staffing comparisons being made.
But just even the sanitariums going from 1 to 3, while they just doubled population, or the nurses, and we don't know what the hours are, so it's all about hours probably when it comes to nurses. But I don't think we have the solid answer, but clearly to me, it sounds like there's more. But I just don't think we should be throwing this all away. I think there's a lot of hard work that's been done. I think it's a large group that has a lot of buying power behind it, and a lot of strength, and can do great work. I think we just got to get with them as a team as opposed to.
Well, so far, they haven't been responsive to me.
So, I'm also struggling a little bit with their meeting schedule and how much our representatives, how impactful they can even be. It seems like their meetings are pretty sporadic. So there was a June meeting, there was an October meeting. Was there a September meeting that they said that there was, but there's no minutes available?
It's June, October, and December.
So they meet monthly, but when you don't have a quorum, you don't have a meeting.
Correct.
So that's what happened in a couple of those months.
So, business happens every day, right? So, an operation has to be run. And if even like 60 days going by without being able to be engaged and involved in this stuff, even if we were to get new representatives in there, how impactful can they really be if meetings don't happen where they're able to participate? I mean, I don't see that they can even review the minutes because I can't see them. How does anybody know what's going on if it's not documented? And I don't know this, but are there any requirements for that stuff to be published in a timely period? I don't know. I guess you can't vote to accept the minutes if you don't have a follow-up meeting. But I am concerned that even if we stay on board and we have new representatives in there, are they going to meet? Are they going to even be impactful if they're there for a couple hours and then 60 days goes by and then they don't have a meeting again? How much influence do they really have in an organization that still runs every day?
And I guess what I'm just hearing, or what I'm thinking, is that Southbury has the problem with the health district. That the health district is, as long as it's a well-oiled machine and it's working and it's getting its widgets in the right place, work's being accomplished. And if they meet 6 times a year to tweak or change but what is the board of directors has already given them the marching orders. If their marching orders are being accomplished and everything's being done the way it's supposed to be done, and, do they really have to get together? Are they, meeting 6 times a year? Maybe that's, floats the boat for getting that work done.
I would argue it probably hasn't been because we haven't been able to get the answers that we've asked for. And some of the reason for that is we didn't meet.
And I wouldn't
And I'm just
exactly
going to venture a guess,
characterize-
because what I've heard, I think, is just that some of the answers they gave us, we didn't like.
Well, we had a meeting here with them, right?
Yep.
Where at that meeting, they said, oh, we're scheduling a meeting next month, and we're gonna do X, Y, and Z. We're gonna come back to the board, and we're gonna,
And they didn't have the quorum, right?
so I think it's a fact. They're not meeting, and they're not posting minutes. We post our minutes within how many days? 7?
Yeah.
7. We post our minutes within 7 days. You don't need to have a meeting to post minutes. We have a meeting tonight. By next Thursday, our minutes are posted.
And so whatever it's worth for that part, if you look at their website now, it's different than it was 2 weeks ago when we met. So there are other minutes like that, the June minutes, like when I said that I saw meetings listed and no minutes, so now up to June is there, and then like.
Up to June, but not October or December.
Well, December just happened and they just passed the October, so it would be posted shortly.
Are
But
we
anyway.
really justifying going back to June? I have to sit here and say, what about somebody what about a member of the public that's concerned about it or wants to know? I just,
All right,
We're going in a circle, and we got a lot more to
Yes.
accomplish tonight.
all right. There's a motion on the floor, made and seconded. I will call the vote. All in favor of the vote signify by saying aye. Aye?
Aye.
Any opposed?
Hey,
And it carries. Okay. Next up, under unfinished, we got that. Next up is police study. That's still ongoing. I'm leaving it on the agenda in order to keep it in front of us. I think there's been some meetings.
We had our first meeting last week, like an organizational meeting. Justin and John are on the committee. We elected Jack Kelly to be our chair, and we're sort of setting up our process for how we're going to evaluate everything. I think our next step to be discussed at the next meeting is going to be identifying police departments to talk to, and we're preparing questionnaires to go out and interview various police departments, and sort of setting up the process going forward. We're planning to have regular meetings monthly, and then we'll schedule meetings as needed beyond that.
Okay. Any questions on that? Okay, pool committee is still on here. They're working on the press release went out, so that's in. Any questions on any concerns or questions by the board on the questions should go to Dan. I think that's what we discussed, so we could take a look. Obviously, not all the questions are going to make it because there's too many, but those, you asked to see them, but ahead of time, and you're going to be able to see them. Any questions on that? All right. Any new business to come before the board? Hearing none. First Selectmen's report. Hold on. I've got it right here. A lot of paperwork here. Here it is. Sorry. First note, police department. There was always a concern. We have 3 officers who are going to, were hired tonight. We were always concerned about getting our numbers up. I've asked all of them, curious why Southbury. And I guess the word is out that Southbury is a good place to be a police officer. Frankly, so 3 are coming. I said, are you concerned about not being organized? And they said no. And they've researched us quite a bit. Most of them do. And I think the good news is I think we're treating our officers, our community are treating them well, and we're having good luck attracting good officers. Public Works crews, we had the snow, the first snow. You see the social media, and there are discussions about the town was pretty happy with the way things looked for the first run. It wasn't a lot of snow, but they did a good job. They always do a good job. They know what they're doing. And you should know, we did have someone retire, and we're short someone else. So we're down a couple, but they still do a very good job doing that. Remind that we spent a little money. If you remember, we bought some trucks. We bought 3 trucks with wing plot to help make it easier to plow some of the snow on the roads rather than having to make more than one pass, and the capacity of the material they're able to carry. And I think that's paying off in that. So that's done good. Plan of Conservation and Development. Several departments in planning department, economic development, assessor's office. They've all been working very hard over the past year, completing the 10-year plan for conservation and development. As stated earlier in the meeting, the anticipated adoption date will be February 21st of 2023. Over the past 4 months, the Planning Commission, they did spend a lot of late nights here in Town Hall, not that we don't, but they did spend a lot of nights, special meetings, and dedicated to meeting the Plan of Conservation Development deadline. I always try to remind them that, I do appreciate that. And there were staff changes and stuff. Thank you for doing it, but give yourself a break. It's not the end of the world if it's another month. It's not the end of the world. And we wanted to make sure it's done right rather than done on time. And I think we're doing pretty good. And I want to thank the commissions for their collaborative work to complete the POCD under these strict timelines and circumstances. Senior Center, today I spent some time down there, the Epic Holiday celebration. It was pretty nice to see everybody having a luncheon together. The seniors, you know, COVID, we're coming out of it. They seem to be happy to go to the center. Good reception. Again, we have good people. The staff down there did a great job. You know, I know everybody's concerned, there's not a director in place right now, but, you know, if everything is set up and running good, it will continue. It will continue. It was a sold-out event. There was a food, band. I wasn't there for the dancing, but I understand there was dancing. And they were very happy to be back at the annual event. There's also the holiday cheer program, which was something we always did. Kathy and the staff down there got that done. They've been going out with the buses delivering to all the gift baskets to members and in the community, and they've been out. And I will be doing next week, I will be doing my interviews and make a final decision on the senior center director. So at the next meeting, you'll have, I'll be bringing a candidate forward for your approval. The town pool survey, I went over a little bit. You know, they're still trying to, or they're currently finalizing the survey questions. Hopefully have it out for the public pretty soon. The press release went out. Again, I would encourage everybody to take to take the survey. Give us the information. I think this board, we all have our thoughts on what we think or want, but it's really, we work for the people of Southbury, and it really is important that everyone participate in that survey, whether it's online, whether it's the paper, or if you happen to get called on the phone. Certainly, if you do an online survey and you get a phone call, please, to the public, please answer the phone and do the survey anyway, right, Justin? That's what we talked about. Even if you do the online or a paper survey, please, if the phone rings and they want to do the survey on the phone, please take that survey. Employees, I just want to say, you know, I was away for a week, and I'm actually sorry I missed this. The employees had what I guess their own pub crawl. They got together and they went to 3 different. I've heard many rumors, and I'm not going to say whatever.
Why wasn't the board invited?
Next time.
No, you know what? If I'd known, I would have probably invited the board to go along and with it. But the key thing is here, they did it, they enjoyed it, but they also raised $150 towards the food bank. And I think the board should know that, you know, there's a donation jar, you know, on Fridays where we can wear jeans, and if you donate a little bit. Sometimes people wear jeans other times of the week, but honestly, I think the jar, but they also took it upon themselves not just to go on the pub crawl, but also to say, you know what, we're going to raise some money for the food bank, and they did raise $150. And the nice thing was that there were employees of this great town who couldn't go on the pub crawl, but still contributed to it, and I wish I had been there. So the board should know that things are pretty good with the staff, and they do care about this community. You know, the police do their toy drive, the police do their thing, and they don't just get a paycheck, they do give back to our communities. So I'm pretty happy with that. They should have let me, I think you have to wear an ugly sweater or something. Is that right? Do we have to wear, on the pub crawl, do you have to wear an ugly sweater or something? Yes. Okay, I'll have to get one of those, because I couldn't possibly own an ugly sweater. Yes, I'll prepare for next year.
Some unintentionally ugly sweaters.
Okay, sorry to keep you late. Any questions for me?
But only thing on the POCD, will that be on our agenda in January?
Yes.
Okay.
Yes, we'll have that. You know, you just got it, you read it. They're finalizing it, make any comments, you'll have them ready. Selectman Betty?
Economic Development will meet next week. Investment portfolio oversight will not meet again until the first quarter of next year. Strategic plan did meet last week. There was actually a lengthy article in the Voices yesterday about their meeting. They heard from Chuck Liddy and the folks at Sustainable Southbury about trying to improve our recycling, pulling cardboard and perhaps food out of the waste stream. Some interesting stuff that could potentially contain some costs there, so we'll see what that's all about. And they also talked about where is it here? Apparently, in our charter, it says that we're supposed to give an annual town report, which I guess we haven't done. I mean, frankly, a lot of the information that one would find in an annual town report is readily available on our website. But that was something that was brought
We
up.
also have our one of the biggest is our audit report. And
Yeah.
if you really want to know the state of the town,
Well, people should come to John Michael's budget presentation in May. I mean, honestly, I mean, that is very comprehensive.
And
But it
actually-
was brought up, it is in the charter, yada, yada. It is our governing document, but there was one other thing that I'm forgetting here. What was it?
we have had clean
Our
audits.
our government website, our town's website scored very highly in a statewide rating card. We actually scored higher than any of the towns around us. We scored a 70, so we're at the very high end of what most towns were able to do. So cheers to everybody involved with that, and our tech team and GOSHA and people provided the content. We're doing great there. So, and that was it.
Yeah, I don't know if the group knows that we had a clean audit, no exceptions.
We expect that, Jeff. We get that every year.
Well, let's not talk about that. We go back a long ways. Jason?
LEPC met last week. It's a fairly brief meeting, but EMD gave a report, talked about the updates to our new emergency notification system. Apparently, we have 22,000 contacts in there, so it's been going well getting people switched over, but people should continue to switch over and sign up, and he'll do like another campaign and put up more signs and stuff in the spring. And Fire Marshal just mentioned that he's started some fire prevention programming. He's doing sessions monthly at various locations around the town. Library Board met last night. The Friends reported that their lobby sale's going well, and if you go there, you'll now see signs for with a QR code and PayPal and credit card availability, so you can go buy books at the library. And they started talking about, like, you never really think about this, their like shop local campaign, like we see that in town, and you could, it applies even to our library, like go to our library, buy books, gifts, whatever. So that's good. A big part of the meeting was devoted to strategic planning. Like I mentioned, I think last month, they've started a strategic planning process with Ken Karen, who's being various focus groups and things included in their strategic plan. Heather, who we appointed, how that's all going.
John?
Relations Task Force. We'll all meet, well, two of them don't even meet this month, so we'll talk about it next month.
Greg is not here.
Next year, there you go.
Greg's not with us. Holly?
My apologies. So the Board of Ed had a meeting scheduled for Monday night, this past Monday night, and I usually